I once again request everyone present in the hall to kindly settle down. Ah. Ladies and gentlemen, may I request you all to kindly settle down, and once again, at the cost of being repetitive, may I request you all to kindly put your electronic gadgets on silent mode. I request everyone present in the hall to kindly settle down. Thank you. Ladies and gentlemen, we've just been joined by Honorable Member Health, Niti Aayog, Government of India, Professor V.K. Paul. May I request everyone to kindly be seated, kindly take their seats. Yes. And I also request all our distinguished speakers to kindly join Professor Paul. We've been joined by Professor V.K. Paul, and I request all our distinguished speakers to kindly join us on to the dais, and we would begin with our first session. Namaskar, good morning, Swagatam, ladies and gentlemen. Very warm welcome to Ficci Heal 2025 with its theme, Care at 25, Defining Moments in Healthcare. Ladies and gentlemen, after a very successful day 1, we now invite you to day 2 and we begin with our plenary session. Please join me as I welcome our honorable and very distinguished speakers of this session. Please put your hands together as we invite and welcome our Honorable Member Niti Aayog, Government of India, Professor V.K. Paul. Warm welcome to you, sir. Good morning. We've also been joined by Joint Secretary, MD, National Health Authority, Government of India, Shri Kiran Gopal Vaska. Warm welcome to you, sir. On the dais, we've also been joined by Professor, Center for Biomedical Engineering, IIT Delhi, Professor Neetu Singh. Warm welcome to you, ma'am. And we also welcome Managing Director, Philips India, Mr. Bharat Sesha, Vice President, Head of Strategy and Innovation, DC Siemens Healthineers, Ms. Harsimran Kaur, Director, Marketing Intuitive India, Mr. Abhilash Sarangi, Country Director, Clinical Solutions elsewhere, Ms. Hema Jagota, and we've also been joined by our convener, Chief Operating Officer, Mahajan Imaging Lab, Mr. Kabir Mahajan. Warm welcome to you. And the moderator of this session, Partner and Co-Head Healthcare Sector, KPMG India, Mr. Lalit Mistry. Very warm welcome to you. And we have also been joined by, ladies and gentlemen, first may I request you to kindly put your hands together and we welcome all our distinguished speakers. And we also are very, very honored to have with us our Joint Secretary, Shri Kiran Gopal. Thank you so much, sir. Once again, we welcome you. Namaskaram and a big swagatam to you. Ladies and gentlemen, this session is going to focus on AI. AI is rapidly transforming healthcare worldwide, with the global AI healthcare market projected to surpass 200 billion by 2030. And in India, AI health tech investments have surged, enabling innovations that improve accuracy, affordability, and accessibility of care for millions. Keeping that in mind, this session will spotlight India's AI-powered healthcare transformation across precision medicine, predictive analytics, and operational excellence while addressing the need of responsible, ethical AI. Keeping those words in mind, we once again welcome each one of you to this plenary session. And now may I request the convener of the session to kindly take over the session. Over to you, sir.
Professor V.K. Paul, sir, friends and mentors from the industry, I welcome you all to this very exciting session after a fantastic day 1 of the Ficci Heal. AI, as we know, is a buzzword, but more and more globally and in India, we are seeing a lot of adoption. We are seeing a lot of investments. About 1,200 plus AI algorithms have been approved by the FDA, the US FDA, for clinical use. Out of that, about 75% are still for medical imaging. And billions of dollars has been invested in this field, in pharma, in services, in medtech, in software. And in this panel discussion today, we hope to hear from the medtech side of things, from the research and academic side, and also from the provider perspectives. So I welcome you all to this session, and Mr. Lalit Mistry can take this forward.
Great. Thank you, Dr. Kabir. And a very good morning to Dr. V.K. Paul, Kiran sir, and to all our esteemed panelists joining us for this panel, and all of you all for taking a time to join this, a very interesting topic, talking about how the AI can really transform and shape the healthcare for future. In the last few years, AI is a very common term and a concept that we all have been talking about and also about thinking about. When I say most of the people, whether it is organization leaders, employees, whether it is a customer, everybody is thinking about how AI will change the way they do the services, way they behave, way they do the work, how it will change in the future. It's one concept that even in healthcare, that has explored over a period of time, especially in the global front. When we looked at, there are hundreds of use cases in AI healthcare that has been explored, utilized, and also embarked upon a larger transformation journey. Well, in India, it's also not very far. I've looked at almost 25 healthcare providers, both in public and private sectors, during this report that we have created and that will be released subsequently. More than 25 such case studies which are moving beyond the POC to really making a dent in the healthcare system. And these are real case studies picked up from the Indian healthcare system, and some of the providers who are sitting here right now as a part of that. We have looked at more than 30 such companies, AI Indian companies, and we should be proud of such companies who have really embarked on this AI journey, where they believe that they can really make a transformation across healthcare services, medtech, and life sciences. We have a very short video to showcase that what this report will be all about, and thereafter we will invite Kiran sir for the opening remark. Can we have the video, please? Let me invite Shri Kiran Kumar Vasaka sir, Joint Secretary and Managing Mission Director for Ayushman Bharat Digital Mission and National Health Authority, who has led a digital transformation mission in. Hello. Yeah. So let's hear sir about the perspective that how the India has embarked from e-health to m-health, and the journey from m-health to a digital health. And now we are looking at a frontier of how AI will transform the healthcare system in the country. Over to you, sir.
Thank you, Lalit. A very good morning to all of you. Dr. V.K. Paul sir, respected members in the panel, esteemed uh, members from the industry, academicians, researchers, and those from the consulting community. I think this is a excellent opportunity, and I would like to thank the organizers for inviting NHA to come here and participate in this event to share a perspective of what is happening under the digital mission, what we are intending to do, or what kind of pathway the digital mission is trying to carve out for this very, very important aspect of using AI in healthcare in our country. Like what Lalit has mentioned, we have moved from the traditional HMIS system which were generally being used either for registration and billing to a more mobile first based approach when we first embarked on CoWIN, and there we showed how a distributed open AI, open architecture based system can actually help deliver services on a large scale at India scale. And as the Gen AI revolution came in with the chat GPT coming up, GPT being released, I think the way we look at solving problems using technology has changed completely. A few days back, we were, we were trying to make some discussion points or talking points for the Honorable Minister on how AI is being used currently in the health ministry in particular, in delivering services or in looking at policy or etc. So there we realized that there are a plethora of areas in which AI has already come in I would say a very initial form. We need to still move towards much advanced cases. The first one was the way we do disease surveillance. Earlier, it used to be just about getting certain forms filled. There are forms pre-filled or pre-decided forms in which information is filled at the public hospitals, and that is collated, and then you take some time to analyze that information and get the results out of it. But with these systems coming in where you are able to crawl the entire web to see any kind of reporting anywhere for a particular disease, media surveillance tool that they are calling out, has actually improved the way we are able to identify certain outbreaks, both in terms of the time taken and also in terms of the quality. Second, the recently conducted TB Mukt Bharat Abhiyan showed us that using technology, handheld devices for analyzing X-rays of TB to identify whether a particular person has TB and therefore would require further treatment or not, has shown how large public health programs can actually be done in a more efficient manner. Similarly, algorithms on diabetic retinopathy and algorithms related to symptom checking and differential diagnosis for based clinical decision systems are already proving to be game changers in the way healthcare is delivered. In fact, if we really look at it, whenever there is an interaction between a doctor and a patient, we all know, as it is, the amount of time spent by doctors with the patient is very precious and limited in our country, given the size and the pressures of population that we have. If only we are able to make that interaction more meaningful. Imagine a couple, a senior couple, let's say 50, 60-year-old couple sitting in front of a doctor and then talking to him about a certain problem. Half the time they are actually discussing with each other, telling each other, आपको दवाई कब लेना था, उस डॉक्टर ने फिर क्या कहा था. If only there were summaries available of their digital longitudinal records which are generated, and if the doctor or the nurse who is interacting with them already has a summary prepared. That valuable time which the doctor is spending in eliciting information from this couple is better spent in and diagnosing the further issue further, and therefore providing better diagnosis. And then on top of it, we add the devices. Hospitals have already been using these devices for quite some time now. Now adding a layer of AI on top of it, be it imagery, for imaging or for analyzing blood samples, or we are, for that case, going forward, analyzing genetic based precision medicine. I mean, precision medicine based on the genetic information of an individual becomes much more possible with the advent of AI. But I would say all of this will be possible currently. If we want to do it, we would still have to rely on models or foundational architecture that is built outside our country, where the models not necessarily are tested for our population base. Therefore, I think one of the important aspects of the digital mission in association, of digital health mission in association with the larger India AI mission that we are working on, is to how do we build these foundational models in our country. Let's say a small language model or a large language model for India specific data sets. That would be the foundational model that could be utilized by any solution. It could be an imaging solution, it could be a speech to text solution, or it could be say a diagnosis kind of a solution. So, and in order to foster that possibility, we need to create an atmosphere where these startups that Lalit has mentioned, these ideas that are coming in, are given that environment where they are able to find the data sets, where they are able to find the processing capabilities in order to test their models and bring them to the market, where pilots are held, where evaluations are done, and our regulator, the ICMR and SEDESCO, are able to evaluate these models and are able to bring them out to the market in a faster way. So the work that we are trying to do as part of the digital mission is to create that environment, work with the larger community, larger ecosystem to bring out these foundational models, and on the regulatory aspect, see the I may have had I may have developed a very good model based on the data that I have access to. It could be a few thousand data points or a few lakh data points. But in order to make a really population scale algorithm or population scale application, I would have to test my algorithm against a data set that qualifies on a few things. One is openness, in the sense the diversity of the data that has come in. The second is reliability, which is where the data source is coming from. Because the more biased my solution is, the more effect it will have the moment I send it outside. Third one, and the independence of the data. I mean, whether it has been collected independently. So I test my algorithm on my system, and I bring it out, and when the regulator is looking at it, they are able to benchmark it against a standard data set. So these are the kind of work that government is trying to do, so that this whole idea of ideation, this whole process of ideation to lab to field testing to finally taking it to the public health scale, or using it in self-care or primary care or hospital care or home care. That is another newer aspect that AI opens up, is why should a patient always be in the hospital? Home care now becomes possible with IoT devices, where monitoring can happen at the hospital level and the patient is still at the house. And using the devices, the wearable devices also becomes much more important. So I think that the pathway that the government intends to take, or the way we are trying to do it in the digital mission, is to create that enabling atmosphere, create those secondary data sets, which will then be available for anybody who like to develop a model and test it out, and then create that regulatory environment where these models are verified and the entire process is speeded up, and then also create opportunities for running pilots at the state level, at hospital level, so that these ideas that have come up as solutions actually become usable and marketable products. So I think there are experts who are from the hospital side, who are on the academic side. I'm sure they'll be adding a lot of more points on this. I think for the government side, it is about how do we create this enabling environment so that we are prepared, and because the conventional way of doing things has changed with the advent of Gen AI. We need to take advantage of that, and how we take advantage of that. And lastly, how do we ensure that ethical concerns are also addressed in terms of not making sure that the algorithms are not biased, they are tested on a variety of data, and also making sure that the use of data. I mean, I suggest all of you to read one book called AI 2020, AI 2041 by one author called Kai-Fu Lee, who was earlier the head of Google in China. He has 10 chapters, each dedicated to a particular area. The first one is about healthcare. It's a 4-page read. It can also tell you what ethical concerns come in when things become driven by AI. So those also need to be taken care of. I think with these remarks, I will give the baton back to Lalit to please take over, carry forward the panel discussion. Thank you so much.
Thank you very much, sir. Thank you very much, sir, for your kind, sharing your insight, and especially about the foundation that ABDM had laid for this country in terms of creating the digital health ecosystem and the forward-looking approach by the government of India in terms of AI mission and the innovative approach like AI Kosh. I don't know how many of you are aware about the AI Kosh, but it's an effort towards by the government of creating a centralized data and enabling environment in terms of your contributing the data. The government data is coming out there. The private sector data could come. The learning models and all that could be available because you have data, but you need some ecosystem where you can experiment, you can do yourself in terms of testing, having the model and all. So it's creating an open source kind of a platform for innovators, providers, and industries to come together and partner in such kind of an innovative approach. Looking forward in terms of the lot things that are happening at the global level, let me invite Mr. Bharat Sisha, Managing Director of Philips, on how AI has evolved in India in comparison to the global healthcare, what's all is happening across the globe, and especially around the revolutionizing the clinical care with emphasis on the clinicians and human resources, how it is able to bring in the efficiency and improve the care system.
Yeah, good morning. Good morning, everyone. First of all, pleasure and honor to be here on this panel and also at this summit. Yesterday was great. Hope today continues to be great. I would like to take a step back, and I think we heard very insightful comments and insight. Thank you. For AI to work or any technology of this nature to work, we need 3 things to happen in society or in our country. The first, there needs to be an explicit need. Second, there needs to be availability of solutions to meet that need. And last for me, and the most important, is there needs to be receptiveness of the users to this technology. And each of these now, we have data points that make us believe that truly India is on the cusp of an AI revolution in healthcare. So let me explain that one by one. So first, let's talk about the need. I think we can all agree that the challenge of healthcare access in India is a long way from being solved. While the density of beds, doctors on a per capita basis is improving in the urban areas, there is still a lot to be done in tier 2, tier 3 cities and rural areas. The solution to this is not only about having more hardware, more equipment, more scanners, but it's also about making our existing infrastructure more efficient. Give you an example. If every MRI machine across the country can do 5 more scans a day, you're talking about millions of people getting access to diagnosis. So the solution for us in India for providing access to healthcare is a mix of hardware and software and AI. So the need is very clear. Let's also talk about availability to fulfill this need. I think we already heard of some of the work the government is doing, which is path-breaking and very futuristic. Not many countries are thinking this far ahead right now in terms of having access to longitudinal patient data. We all know health is not a photograph, it's a movie. And we need to see that movie as a doctor is ready to treat a patient. Providing quality time for the doctors. Doctors signed up to be doctors, not to look at screens, but to look at patients. How can we free up their time to spend that quality time with patients? All of this is today available. Solutions are available, are scalable. And my company does a lot of this currently. Other companies do in terms of providing this capability for doctors, clinicians, healthcare professionals, and above all the patients to get access to care. Those solutions are available. Now let's talk about receptiveness. And there I would like to quote a survey that we do every year called the Future Health Index. Philips does this across the world, including in India, 16 countries. What was very interesting for me is in the last survey that we published in July, we asked patients, how receptive are you towards AI as an enabler to healthcare, right? The global average was 59%. 59% of the patients said, yeah, we would like AI to be an enabler to healthcare. What was very, very heartwarming for me was the Indian average was 79%. 20% more than the global average. Our patients are ready. We are ready as a country to take that leap into AI. So for me, all these three contributing factors are what make me very optimistic, along with the policy decisions the government is making, the mission AI that is happening, the longitudinal patient data that's being done, the open source way of approaching solutions. All of this for me make me very optimistic that India is going to leapfrog in AI for healthcare compared to other countries in this world.
Thank you, Mr. Bharat. And one of the most explored area in AI is about health screening and about the diagnosis. Let me invite Ms. Harsimran Kaur, Vice President and Head of Strategy and Innovation at Siemens Healthian. How does AI has potential to increase the speed and the precision of a diagnosis, and how it can really change the way the diagnosis is done, especially around the health screening and especially around the remote areas where the access to the healthcare is a challenge. Over to you.
Hi, can you hear me? Yeah. Firstly, a very good warm welcome to all of you and a good morning. It's an absolute pleasure being here in this team, company of Mr. V.K. Paul and all the other delegates. Maybe just a quick personal bite. I've been out of India for more than 20 years, and it's my first Ficci session being here, and yesterday coming up the staircase, looking at all the pictures that were there on both sides of the wall. It was incredible to see the legacy that is there and the history that is there. So an absolute honor to be here. And I think all of you, all of the things that we spoke about, the work that is being done by the government yesterday as well, Srimati Punia spoke about it. And I think we've seen that with what has happened in the financial inclusion, right? With the India digital stack, right? How financial inclusion has happened and how India has really leapfrogged. And I think that's the same opportunity that we see in healthcare today. The work that Sir you all are doing with ABDM, all that is happening, and the 7 pillars that the India AI mission has set up, we are very optimistic, pretty much like my colleague here mentioned. And I wanted to maybe just share, and I think you started here, Mr. Mahajan, around AI being the buzzword. And we spoke about also how emerging economies, and there's a lot of data that shows emerging economies are much more excited. And there's a much more fear and apprehension when you look at the developed world. Because as emerging economies, we see that with AI, we really have an opportunity to leapfrog. There's a wonderful opportunity to use innovation to leapfrog. And I think we were talking, Lalit, in the morning about going deeper into use cases, and maybe I can share. In precision medicine, I have a couple, but maybe I'll just share one. Don't want to take too much time. And I think, so one of the key things, of course, I'm from Siemens Healthian. We talk a lot about this triangle where there's patient twinning. We talk about precision therapy, and really connecting both is digital and AI. Yeah. And what the question that you asked around precision therapy, I would like to share an example from planning of radiation therapy, right? So when we are planning radiation therapy, and I think my colleague from Philips also, you mentioned around the growth of generative AI, right, in healthcare. Why has been so much? Because there is a lot of scope to optimize. Yeah? When we look at this task, there is something called contouring, right? We do organs at risk get contoured. Let's take an example of a patient, right, who has brain metastasis. And there are lots of lesions in the brain. And if the clinician today has to contour each of these, you need to do it properly, right? So as an organization, we never say that AI will replace the clinician. It is here to empower, and it is here to augment the clinician, right? So if you have to sit and contour each of it, that is a very lengthy task. But you need precision here because you cannot leave out any part of it, and you cannot damage any of the other organs, yeah, sensitive organs which are around it. Say the eyes, yeah, parts of the brain, right? So you want to do cognitive sparing as well. I can share a study done in Turkey. Yeah, so where the doctor said, this deep learning algorithm that we worked on reduces by 30 minutes, yeah, the time per patient, which is significant if you look at the amount of cognitive overload that is there today. Now, we don't say that we remove the patient, right? You always need the human in the loop. You still need the human, the clinician, to review the work of AI, because the topic of trust always exists. So 2 to 3 minutes of time that is needed for the human then to look at it. So I think deep learning, generative AI, both of it, right? So it offers lots of opportunity to drive productivity and also to reduce the variability. Yesterday we spoke a lot about building trust, reducing variability, increasing patient outcomes. So here is a use case where there's been significant adoption. And of course, I think you, sir, spoke about validating it. So we validate it manually contoured by oncologist, and then we said, okay, we compare it what the AI feeds out. Yeah, so almost 95% of the time the contours are correct. Yeah, but you still, and we compare it, you see very little tweaking is required. Yeah. So I'll hand over the baton back to you. Just sharing a use case. So it is beyond buzzword, but again, the MIT report, which was released recently, said 95% of Gen AI experiments are still failing, right? And I remember yesterday, one of the panelists from Gates Foundation who said, my biggest learning is we don't bring the solution and then tell me, let's fit it to the problem, yeah? Find the right use case and then you'll really be adding value. So I just wanted to share this use case, which works and we've seen that has helped in the precision therapy space.
Great.
Lalit,
Thank her, Simran. And there's nothing more than putting up a real world use case to a paradigm shift and making a dent in what you're doing. And I think we have Kabir Mahajan to share a real world example of how the use case has transformed into a revolutionizing the diagnosis, especially around the radiology and imaging, and how it can be done. And it's not a thought process, it's actually happening as we speak. Over to you, Kabir.
Sure. Thank you, Lalit. So just continuing on from where Ms. Kaur left. So in our organization, we have actually implemented and very unwillingly also invested in AI algorithms, but they are providing value. The most important part, like what Bharat sir also said, is if we can add value and add more patients onto the same machine while improving or maintaining the same image quality. I think in 5 of our MRI machines, we have done that and we are seeing very good results. As we all know, it's not always possible to pass on inflationary costs onto the patients. So we are realizing now that we are able to do more number of scans while improving image quality in the same amount of time. So thereby adding productivity and efficiency. So this is one very real way in which we are utilizing AI algorithms. And we've also seen complicated scans such as cardiac MRI scans where it could take about an hour and a half for one scan and the patient has to be very cooperative. It's not the most easy scan for the patients. Now the same scan is being done with better image quality in about 40 minutes or so. So these are again very real world examples. We are piloting and in fact now doing it on actual patients. And of course, patients are very happy. We can do more or hope to do more in the same amount of time. The other way in which we are using AI is more on the non-clinical side, more on the operational efficiencies, where there are solutions available that can automatically position the patient in a CT scan machine. So in a high volume center, even a minute or minute and a half saved per patient is a lot. And that again, we are seeing value in that in a high throughput center that we have. So saving a minute just on patient positioning saves technician time, and we are able to do more in the same amount of time, adding to our throughput and efficiency. So these are two very real examples. But beyond radiology as well, more and more we are seeing how imaging data is being now combined with biopsy data to produce fantastic algorithms for prostate cancer screening, where you input an MRI scan and actually you get a targeted analysis report where it can even detect a lesion. And all of it is fully automated and scan times are becoming shorter, image quality is improving. So I know in UK they are piloting such solutions for prostate cancer screening. So again, early detection, especially in a public health setting, can lead to significantly lower public health costs. And these are again very, very real examples. More and more, we are also seeing in liver disease that MRI data being combined with liver biopsy data to produce algorithms. And this is, in fact, the next wave of AI algorithms that we are seeing, where not just imaging data, it's clinical data, biopsy data, genomics data, all being combined to give a singular output. So, just these are some very real examples, and also in the future, I think more and more screening solutions will emerge. There is a lot of movement in virtual biopsy. Now, going through a prostate biopsy or liver biopsy is not very comfortable for any patient, but there are screening solutions now available. The other use case, again, Kiranji also touched upon it, is in TB screening, where in fact, a company we incubated, Carpal.ai's platform is being used to house various algorithms for TB screening in the rural areas, where thousands of patients are being, individuals are being screened on handheld chest X-ray devices, and in a minute or two, the AI is giving out results for normal or abnormal on a chest X-ray, and only the abnormal studies are being sent to a radiologist or for a sputum sample. So again, this is happening as we speak in the most remote parts of India, on algorithms and on platforms developed within India. So I think, as we heard, it's not just a buzzword, it's a very real solution to a lot of problems. Initially, I do remember there were solutions available and they were trying to find problems, but I think now that has pivoted. And given the huge shortage of trained manpower, not just in India, but in the West, I think more and more such solutions will emerge. So.
Great. Thank you, Kabir. And I can say that one thing that, in the last decade, at least you and your family has been one of the early believer in the AI and how AI could really enable the healthcare in a better way. Instead of considering as a threat, you really saw that how the complementing values could be derived from such kind of an opportunity. And you can see from the use cases translating into a transformation today that it's a really a good thing that you have driven, especially from a clinical aspect about it. But there's one area which has been for a pretty long time, how the AI has been utilized unknowingly without knowing, seeing on actual, is about the robotic surgeries. A software in medical devices, software as a platform, and a lot of other things have evolved over a period of time. The government has to recognize them as a separate set of, distinguished under the medical devices and so on across the globe. But very specialized area onto robotic one. Let me invite to Abhilash Sarangi, who is a director in marketing, Intuitive India, to talk about how AI capabilities are evolved in the robotic surgery and how it has potential to really enable a better surgical care and derive the better outcomes.
Thank you. Thank you, Lalit. Good morning, everyone. Thank you to the organizers for having me here. It's been an absolute privilege to listen to some of the stalwarts and visionaries of our industry. So, Lalit, to your question, we've had panelists today share their take on how AI is helping with diagnostics and imaging. I'm going to shift gears, talk about surgery. Now, historically, surgery for many people has felt like something of an art form, right? Where the surgeon's skill, experience, intuition, and extraordinary manual dexterity has helped them deliver outstanding outcomes. What we are finding now with robotic surgery and with AI and data science is that we have the ability to transform what was once considered art into a fairly precise evidence-based science. One that is reproducible, predictable, and learnable. So let me explain. The thing with robotic surgery is there's a computer between the surgeon and the patient. And what that allows us to do is track a wide range of data sets, which helps us to describe what exactly is done during the surgery. Some of these data sets can look like, for example, the video data, surgical video data, what the surgeon is seeing while they're operating. robotic system events data, or what the surgeon is doing when they're operating, kinematic data, or how the surgeon is moving their wrists and their fingers during surgery. And with advanced computational capabilities, we have the ability to also measure things like force. How gentle is a surgeon being on the tissue versus another surgeon? The ability to take all of these different data sets and combine them can shine light on very specific aspects of surgery, such as what does good surgery look like? What does safe surgery look like? What skills do the best surgeons employ during surgery, which leads to outstanding clinical outcomes? So, with all of this insight now, we are already beginning to see how some of this is being used to transform the way in which surgery is taught and surgery is learned. So, one of the things that I think several panelists have also mentioned is about having a vast foundation of training data sets that are open, diverse, independent, and voluminous, which capture different anatomies and patient physiologies. The Da Vinci robotic system today has been used for over 17 million surgeries worldwide. That's 17 million unique data sets as well across the globe. Today, with access to that sort of pool of data across the different data sites that I mentioned, we are finding new ways of surgeons to begin to understand how they're operating. I'll take a small analogy to help explain this. Yesterday, we spoke quite a bit about cricket. And so if you go back a few decades in cricket and you think about how coaching in cricket was delivered, you'd have a player being as good as they are based on innate talent and based on a coach being able to really observe and identify the specific areas in which a batsman needs to improve, for example. Today, the situation is very different. As soon as a batsman gets out and goes back to the pavilion, they have access to hordes of data, video analytics, technique analysis of about exactly how they played certain kinds of deliveries, the spinning ball, the seaming ball. They know exactly what they did not as well and what they need to improve before the next game. With our newest Da Vinci 5 platform, we have a suite of solutions that unlocks these types of capabilities for the surgeon, where a surgeon can finish a procedure, fire up an application on their phone, and instantly have access to lots of performance data about what they did during the surgery, how that particular surgery compares with their historical averages, and how it compares with their peers globally and in their country. And they can use this to identify specific areas, skill areas that they may need to improve before the next surgery, go back and practice those skills on virtual reality simulators. Think of it like net practice for surgeons. Being able to kind of leverage data science, robotics, and AI in this way is really helping provide a new degree of insight to surgeons that can help them improve continuously, and also is changing the way surgical training is delivered. For an experienced surgeon, you don't have to now observe an entire surgery that a junior surgeon is doing. You can look at their data, you can look at specific parts of the procedure and give objective skill-based feedback, which is backed by science on what they need to do before the next procedure. So some of this is already happening. The potential for the future is much wider.
I'm sure we are looking at a digital twin of a surgeon and clinician in coming time who will be equally able to replicate some of the skills and the refinedness and the expertise and the experience that a surgeon brings, housing into a digital twin and enabling and supporting, not replacing ever in healthcare. Let's go to the very interesting topic on how the AI is also enabling in terms of defining the way the research and the transformation is happening across the biomedical research. And let me invite Professor Neetu Singh, head for Center for Biomedical Engineering at IIT Delhi. They're working on a couple of very interesting areas in terms of how the biomedical research is enabling the futuristic discovery of the solutions and the innovations around it, especially around the AI and how AI is helping them to do these things better. Over to you, Professor.
So it's an absolute pleasure being here because I think I'm learning a lot, hearing from the industry leaders. And I will be the skeptical one among all of you because I would like to break down what we in academics are thinking about AI and the opportunities with AI in healthcare. So I think we spoke about AI and we understand what it is, the need for it and all. But let me break it down. The reason why we want to do AI for India or for any other country could be different, as we talked about it. For us, it could be scale, saving time from the doctors and getting more patients checked and things like that. But in general, AI is all about automation, scale, and precision with, of course, personalized solution, right? We are not doing AI to just save time. We would like to actually give personalized solution to every patient that enters. That's the dream. Uh, each word that I've used, which is automation, scale, precision, and personalized solutions, requires a lot of research. It's just not a casual way I'm using it here. For example, for automation, we need a lot of technologies. How do we automate imaging, for example, or like doing multiple patients, like a serial or something? That's something which we're not even thinking. That requires technology. We're doing one patient at a time and things like that, right? How do we do that? Can AI help us with those kind of things? Scale, for example, industry is all about scale. I think we should collaborate with industry to get our technologies to scale, right? How do we scale it to everyone? And I'll give you a simple example of the challenges that we're facing, especially what researchers are looking at. Now, automation, scale, and precision with data. What is the data? Where is the data coming from? I'm not talking about it. What kind of data? It is clinical data, genomic data, imaging data, all kind of data. Do we have that data set with us? The data that we are working on right now, it's actually a few years old, let's say about a decade old. And only now we have realized that there could be AI solutions to it. So now we are trying to somehow use it, right? But actually, we do not have the genomic data for the same patient that has the imaging data, right? So it's actually, we are working again in silos. We are not working together towards precision medicine. Yes, we understand it now. So now we will start gathering that data, which will be good quality. And maybe in another 5 years, it's not 10 years now, another 5 years, we'll have some solutions which are better. But what we are working on, the academicians, with the data we are working on is actually not good quality, not just because it's not annotated and other things, but because it's just, you don't have the metadata, we do not have everything from one source, right? So that's what we're talking about. So I feel like we need to work a lot on the quality of data. We need to break those silos. We need to talk together. Now, let's say we've gotten data. How do I take it to deployment? How do I do the solutions to it? So a patient comes into the clinic, there is some imaging done, there is some blood test done, some profiling done. How do you scale, again, the genomic data? How do you tell the patient what kind of drug doses is required? All of that is actually one packet solution, right? So we need to put in a lot more research into these aspects as well. For example, imagine getting the cancer patient coming in. Of course, you're doing imaging, you're getting tumor biopsies. The tumor biopsies are creating digital twins in terms of, or maybe in vitro twins, we're getting multiple samples from that patient biopsy where we can create in vitro tumors and then look at drug dosing. So this is happening in parallel. But where's the technology? We need to develop lab on a chip technology for it. We need to develop, of course, AI models for it, better microscope. So I think the research is required at various ends. And as an academician, I'm looking at all these smaller details that goes into it. And I think industry and academia are working at different paces. I think industry is really fast and they want to give it to the end users because that's their job. They're interfacing. We're a little slow in terms of, we're looking at fundamental problems. We're looking at what will happen after, say, 5-10 years, and how do we give up overall holistic solution to this whole thing. So I'll stop here. Thank you.
I think very valid point on the data aspect. Let me tell you one thing in the health data, the providers and the policymakers don't use the data to an extent to what a technology providers use the data for. In fact, they really value, if you see any of the tech giants across the world, without naming anyone, their main priority among the top three is one is healthcare. They've heavily invested in healthcare. So you can understand the value and the potential that they see in the gold mine that sits out of the data, not from terms of monetizing, but the impact it can deliver through the technology and the enablement. The very important element is that this data is being utilized and the data is generated by every individual every day, every moment, every second. Every time you move around, every time you use your phone, every time you access anything, every time you do anything, the data is getting generated, which is really helping about your behavior, about the things. The data from environment and overall health risk is being used at how the population health can really transform. Let me invite Ms. Hema Jagota, Country Director for Clinical Solution, Elsevier, to talk about that how the data is can really transform the population health and especially around what kind of enabling environment around policy and the governance framework that is very critical for doing things that in the clinical as well as in the population health. Over to you.
Thank you, Lalit. Good morning, everyone. Firstly, thank you for inviting Elsevier and me as the representative to be a part of this August panel. It's exciting to see all the key industry stakeholders participating in this two-day program on how we can roll out AI responsibly at the point of care. It's important for all the key stakeholders, be it policy makers, academia, different industry organizations, to collaborate and make a sustainable impact in healthcare. Now, I will first summarize the perspective on how AI can accelerate the improvement of health outcomes. Basically, Gen AI has catalyzed the speed at which evidence can be made available to the clinicians, the nurses, the allied health professionals across the care continuum at the point of care. We have always been referring to the quality of data, the research, and we have been trying to make sure that evidence can be provided in the right hands, which is the clinicians and nurses who are handling complex cases with comorbidities at the point of care. Now, AI has the potential to catalyze the latest evidence and summarize it in a form so that the clinicians and the nurses, the integrated care teams, are not drowning in data, but they are able to leverage it to do meaningful differential diagnosis. Now, the clinical relevance and accuracy of the data has to be kept sacrosanct. So it's important to have a very large and deep set of data sets. It's important to ensure systematic reviews and peer reviews are conducted to ensure that the highest quality of information is presented to the clinicians, the nurses, and the allied health professionals at the point of care. Now, what are the principles that have to be applied to ensure the highest quality of data and evidence is presented? The data has to be citable. So, Dr. Neetu referred to the quality of data, and this has also been alluded in multiple meetings that we've been having over the last 1.5 days. So it's important to make sure that only citable, evidence-based sources are used in analysis. It's important to ensure that the bias is reduced. And that's where the creation of LLMs, which have run on these high-quality data sets, is important. Thirdly, in India, we see a lot of endemic cases. There are diseases that are prevalent in our country, so it's important to have localized evidence made available. Now, all these different types of data sets can be presented in a very simple, easy to read format through AI solutions. So that's why the Gen AI revolution has actually made it possible to ensure that the latest evidence, which the clinicians were always referring to, it has ensured that the latest evidence is presented at the point of care, enabling the clinicians, the nurses, to perform better care, ultimately leading to better health outcomes. Coming to population health management, AI also has the potential to support the entire care continuum, right from primary to secondary and then ultimately super specialty tertiary hospitals. At the primary health workers, we know that the frontline health workers, the ASHAs, the ANMs, they are the last mile healthcare delivery agent. So it's important to upskill them to capture the primary health data, which will ultimately help in disease surveillance, ultimately help in capturing the high quality grassroots primary health data, which is where 70% of India resides. And the potential of AI in enabling the frontline health workers to conduct primary health screenings door to door, to enable early detection of non-communicable diseases, and ultimately leading to creation of a high-quality data bank which can serve as food for policymakers, for further analysis for the health tech ecosystem is tremendous. So very excited to see Gen AI solutions across the care continuum and look forward to working collectively with the ecosystem to truly make a sustainable impact and ensure that India, which has always been the tech backbone, becomes the AI leader of the world.
Thank you, Emma. And I think AI is in a similar stage where the computers started in late 80s and early 90s, where the computers started getting adopted at home and the offices. We are in a similar era where AI is looking at the similar thing. We started with the basic mobile phones some year back. We moved on to a smartphone, and now today you get is a smartphone with an AI enablement. Without even knowing, AI is actually part of your day-to-day affairs, and you are using it on a practically and an accessible technology for day-to-day affairs. Having said that, let me invite Professor Dr. V.K. Paul, Honorable Member Health Niti Ayog, for his closing remark on this topic and way forward for us in terms of using AI in the healthcare. Over to you, sir.
Honored to be here amongst the leadership of the health sector of India. Honored to be here amongst very eminent panelists who are actually iconic leaders in their own right. This Ficci Heal is an event that we all look forward to for ideation, for convergence, for partnerships, and truly be a force for uplifting the health access, effectiveness, and equity for the people of India. And your theme this time, defining moments in healthcare, couldn't be more apt. And the topic that we have this morning is truly fitting into that in a very, very, very special way. We are in some ways at the crossroads for harnessing the potential of AI because the momentum is building. We are in the game. We have the potential to lead the world, and I believe it is our destiny. I repeat, it is our destiny that India will lead the world in AI, in general, in all sectors, for many reasons. It's also an imperative for India for its journey to be a Viksit Bharat by 2047. With a disruptor, which happened, after 100 years, perhaps this disruptor is the biggest disruptor ever in human history, perhaps. If we don't master it, it'll have consequences for where we would like to see our society in coming years. It's so important. As you know, Niti Ayog is engaged in this process. We have a frontier technology hub. We have been putting out very important papers into the public domain. Essentially, we believe that India should not only emerge as the biggest adopter of AI, because we will absorb a hell of a lot, but also the biggest creator of AI. And that is, as I repeat, that it's an imperative for us to reach that glory of 2047 in terms of our growth and as well as our societal goals. One of those goals relates to health goals. So it's so important. Having said that, first part of what I like to emphasize is the big dimension of AI. And I think my distinguished panelists have brought out that dimension in a very significant way. If this meeting was last year, and last year's meeting, if you recall, we would be saying, oh, diagnostic कर देगा, ये diagnose कर देगा, उसको कर लेगा. ठीक है, इतने पे ही बात होती थी. Today you are hearing much more than that. You heard just now the role in public health. May not have been spoken in meetings. It's a different dimension, and I want to build on that. We heard precision techniques. We heard how we need to be building data sources in a significant way to create products that are robust, and you heard the regulatory part and so on. So actually this discussion, I congratulate the leadership of Ficci. This is building on what we should be very actively thinking and acting upon. And I'll come to what I hope we can work, you and we all should work in terms of specific actions. I like to put 4 filters to the AI story, partly spoken, but just to build on that, that there is not one way कि diagnose करेगा, वो X-ray में TB ढूंढ देगा, या वो patient assistant, doctor, physician assistant बता पाएगा. There is hell of a lot more, and you heard that. But let me enlarge that in a certain way. I see one filter as health promotion. It's not medical. It's also medical, but it's a much wider dimension. How can we use AI for personal health as an enabler of personal? It's a dimension by itself, by the way. You have been wearing these, wearables, etc. So it's not something new, but I want to say there is a space out there for prevention, for health promotion, for well-being and wellness. Think about this as an opportunity. And we perhaps, again, I'm pointing this out also from the fact that we have some areas where we can be ahead of other people, and in some area there's already a competition. Perhaps prevention in the context of our own people is something which we can do more about, because it is contextualized. It's to our body fat distribution. It is related to our genetics, and so on. It relates to the problems such as sickle cell disease and thalassemia. I mean, there is a context to it. Either we do it for ourselves, or we just pick up something, adopt here and there, which is contextualized to maybe a segment of people coming from another country. So think about health promotion. It's about diet, activity, yoga, meditation, Ayush, vaccination, community health activity. Look at that space. Individual and collective effort on health promotion. And can we make a difference to this, to our society in this regard? Because NCDs is all about good lifestyle. And think from that angle, and then look at the products and the use cases and how to work in that area. The second one is classical. You heard those examples, I will not repeat. And this actually relates to disease profile or diseases or disorders across lifestyle. So this to me is only one filter, right? And a lot of space discussion happens around those use cases, and rightly so, because that's where the bulk of what we can do can happen. But I want to remind you that women's health is special. There's a problem like substance abuse. We don't hear about this. Healthcare of the elderly, we hear some. Rehabilitation, दिव्यांग, इसको widen करो. सिर्फ वही चीज़ों की ही नहीं बात करो, that hypertension of the world and the diabetes of the world. I just want to say that there is hell of a lot more. Child health, learning disabilities, child development. You know our learning outcomes in the schools. Class 3, only 30% can read class 2 stuff in rural India. Part of it is education system, but part of it is child development, early stimulation. All those trillions of connections that are being made to be harnessed and to be built on. And why should an Indian child lose even one single IQ point for want of that stimulus not being there? And another country, their children don't lose that. And add this to the number of children that are there in our country. The point I'm making is, look at this dimension of child development, of course, genetics and rare diseases, and also, can we talk more about communicable diseases which must become extinct in the next 5 years? By the way, we have that agenda. The point I'm making is I want to remind you about hell of a lot more that should be thought through the filter of these priorities or through the filter of AI for these priorities, whichever way you like it. TB, we are using AI. What about leprosy? What about lymphatic filariasis? Kala-Azar, measles, rubella, malaria? All these are slated to be extinct from our soil by 2029 and by 30, if you look at the SDG goals related. 7 of these diseases should become extinct by 2030. And 6 of them, malaria will need certification 3 years, but the other 6 have to be done by 29. Our own goals are saying that. Lymphatic filariasis, for example, is 28. As an example, leprosy is 29, I guess, 28. So, आप थोड़ा वाइडन करिए, ये मेरा अपील होगा, उसी में ही नहीं रहना है, जो बातें हम सुन रहे हैं ना, हो रहा है वाइडन, and I am giving credit to my very distinguished panelists here. So this is the disease, disorders, life course, fetal well-being hasn't been spoken much, Our stillbirth rates, I think, should be improved. Neonatal mortality looks good, improving, but what about stillbirth rate and so on? And mental health, I didn't mention that. Mental health, a lot needs to be done. तो थोड़ा सा इसको जरा बड़ा canvas बनाते हैं. The third dimension is health systems. And some triggers came from the panel. We have to look at applications which are not necessarily, of course they should be, patient interaction, secondary care, tertiary care. I'm glad primary care has been emphasized here. That's where the real action is. And you heard some examples. We need to discuss more how AI can be harnessed in the health and wellness center to make decisions. How AI can be harnessed to detect in that area an individual who needs 100 rupee presbyopic glasses to change his life and improve productivity by 20%. So there is a health system, one dimension. There is an Ayush system. There is insurance. There is fraud. There is, secondary healthcare system, and tertiary institutions. So there is a health system thing. Many solutions will apply across, but some solutions have to be targeted to the health system. And in the health system, human resource development is one part that I like to think collectively about it. How can we improve learning of our nurses, of our doctors? What do we do through the NMC system for our medical colleges? How do we make future doctors ready to use AI on the one hand and use learning, education pathways assisted by AI that can make a difference? So adaptive learning, personalized learning, VR, AI enabled learning, training teachers to do a better job. तो ये एक और डायमेंशन है. इसमें दुनिया में कुछ हो रहा है, हम उससे आगे जा सकते हैं. तो in these dimensions, we have our destiny awaiting. The last one, the fourth dimension, is about public health. Ms. Jagota has highlighted. Public health is about health determinants, genetic, environmental. It's about disease surveillance. We can do more from the government side. But what about disease modeling? In the COVID time, we had a lot of problem with trying to model, foresee. Can we now be stronger? And disease modeling, also in the sphere of communicable and non-communicable diseases, not just communicable diseases, but also non-communicable diseases, environmental health, climate change, disasters, air pollution, and then, of course, public health management, supply chain, delivery, sufficiency of drugs, precision public health, where it has to operate. So this whole world is actually waiting for us to contribute to. So therefore, my first point is enlarge the spectrum of discussion around AI. That's the first thing. Please, we need more discussion, and we should really get players into it, because things like public health, we have leadership waiting for us to make a difference. It is, for us to do that, because the world would really take that, and of course, clinical trials, etc. So that's my first input to you. Second, I think the concerns must also be spoken. Some have been spoken. Quickly, 3 concerns. One is the algorithmic bias. Selection, what is it the algorithm based on? This point has already been made. It's a serious issue. And it gets connected to validation. I'll come to that in a minute. We have concern about data privacy, concern about actual security, that AI algorithm can lead to the wrong direction, and it could be a malicious attempt on part of somebody else. So security, is an issue by itself. Ensuring equity, that when we have solution, they respect equity. So ये तीनों चीज़ें ethical area में हमें ख्याल रखना चाहिए, उसके बारे में चर्चा होनी चाहिए. The third one is actually very important, accountability. And that brings me to the validation part. Let's say an algorithm says, this detects cancer cervix. Okay. Very often we'll say, okay, for data set, yeah, we kuch kiya hai humne, theek hai. Then we say, what about, we understand, natural intelligence understands sensitivity and specificity. Someday we will do away with all that. But today we want to know how many out of 100 would it miss? And that index, that parameter is called sensitivity. Suppose it says it misses 5%, okay, against a gold standard. Is that acceptable? To 5 of us who have cancer, the algorithm tells you I don't have cancer. And my next cycle of assessment is after 4 to 5 years under the current program, and maybe after 3 years in the follow-up norms that you may follow. I'm gone. Who is responsible for this? This is the responsibility part and accountability part. We need to discuss how we need to handle it. मुझे गलत कहेगा. It tells me I don't have TB, but I actually have TB. And then I end up with TB meningitis. How do you handle it? Or overdiagnosis? The other side, the false positives. इस bandwidth में चलने के लिए मुश्किल ये है कि जो AI tools बना रहे हैं उनको इसका knowledge नहीं. They don't understand the imperatives of this, so therefore a room for co-creation. शुरू से आपस में बात कर. जल्दी नहीं पड़ी हो. You create hype for a product. हमने बना दिया. Let me elaborate on this. There's one company which says, chest X-ray, I can diagnose anything. अच्छा, सब कुछ कर लेते हो. हाँ, सब कुछ कर ले. हमने 100 पे किया, 150 पे किया, कुछ भी कर. There's another one which says, we are good at diagnosing 6 conditions. TB, pneumonia, something and something, right? They are the wise people, because chest X-ray, we have, leaders in radiology, has, by the way, bones, it has heart, it has vessel, it has interstitium, it has pleura. आप कौन सी बीमारी की बात करते? सब कर ले. प्लूरा का करता है. इसको कौन बताए? इनको ये पता ही नहीं है. उसमें हार्ट होता है भाई, सिर्फ चेस्ट की, लंग की फाइंडिंग नहीं मुझे चाहिए. क्या एकाइनोकॉकस को भी पकड़ लेते हैं, सिस्ट को पकड़ता है. वो ऐसे लूज टॉक करते हैं, which is so disturbing, because they have hype, they have visibility, they make beautiful films. तो मैं कहूँगा कि इसको सोचिए, ये डिस्कस होना चाहिए. ये एक्चुअली हमारा काम, लेकिन हमें मिलके ये काम करना है. आपको ये कहना है कि मिलके बनाओ. There is a huge danger in this. ये भी कर देता, सब कुछ कर देता है. I have made a habit between us, and I invite you to take part in that discourse. I systematically, every 2 to 3 weeks, hold VC meetings with 3 to 4 technology innovators and inventors, academia and otherwise. उनको guidance देते हैं. I can tell you 9 out of 10 times, one person will be good out of 10. कि ठीक रास्ते पे. 9 of them are faltering in this particular space by and large. छोटा sample size, hype, some NEI, overestimation, और आप तो रोज 100 आते होंगे आपके पास. So that brings me to now the recommendations. First, validation. We need to create a system that technologies that we develop, we validate them. They go through a filter which the natural intelligence can accept. There are rules, and those rules need to be applied. And here, the nation needs to create with your help a system of validation. A large lab like yours, Dr. Mahajan, can validate diagnostic algorithms in the imaging space. For something, we have to go somewhere else, to a neurosciences center, or and cancer center, and so on. So we need to create an ecosystem of validation linked to regulation, which is part B, for which we need to tweak our regulatory system. We don't have it. You can't start treating this as a drug, doing clinical trials, and use that rigor, so-called rigor, and then mess it up completely. So we need a balance, but we need processes, and that's one work that we would like to do with yourselves. Number 2, make data, India, health data capital of the world. How do we do it? How do we share it? That's where your job comes in, NHA. How do we do it? without being intrusive and without controlling. And yet, how do we make India as a data capital? Because we have so much of data, but it's all lying here and there. And the data quality has been highlighted. It's a big issue about data quality. How do you sift it? I'm sure there are ways of doing it. So how do we make our nation as a data network of sort, a powerhouse of data? You have a lot of data in a particular space. There is public health data in other silos lying there. Primary care data still to be perhaps put in place, health promotion. I'm saying this is an imperative. Without that, how do you move forward? इसके ऊपर हमें काम करना होगा. This is a higher level action. Please, let's create groups to do so. Let's not lose time. It's about India's destiny, I can say that. Third, it has been said that, AI will replace workers who don't adopt AI. Okay. The workers will be there, but it will be those workers who will adopt AI. The same thing applies to all of us. AI will replace healthcare providers and managers and owners of chains if those who don't adopt AI. How do we work on the building capacity? How do you educate today's doctors to start using these gently but systematically? A pediatrician, a cardiologist, an orthopedic surgeon, neurologist, hospital manager. हमें पता है सिखाना कैसे सीखा, टूल्स के साथ ही सीखा. इसके बारे में क्या आज शुरू करें? आज तो थोड़ा बहुत है सीखने के लिए. अभी एक साल के बाद में इतना होगा कि then will be too much. So building capacity to be able to adopt, we need to work together. And Ficci and Nat Health and CII, please, as family, can we all look at that direction? Start with simple things. What is the AI tools and AI capabilities that my nursing colleague should have in an emergency room or obstetric ward? हमने अभी ये शुरू नहीं किया है काम. इसको करना होगा. Fourth, indeed, products should be done. I'm just highlighting it. It has been, I have stated it. Solutions need to be made, and they should be made in all the dimensions that you heard from us, and some you heard additionally from me, and some perhaps not even have been discussed. And they should happen, but let's create a system in which we co-create those. Players are already in the picture. This is a mistake we are making the same way as we made for physical devices. वो डिवाइस बना के इंजीनियर बैठ जाता है, फिर कहते हैं इसको चलाओ. वो तो चल ही नहीं सकता. आपने बच्चे पे तो लगाया ही नहीं कभी. Right? So इस तरह से नहीं co-create करना है, but surely the products should happen, and we should let loose the capabilities of our industry, our startups, our R&D system to get the products out. Keeping in mind that there is a spectrum where everything is important, but where there is a unique contribution that must be made, or an area like public health where it is imperative to make investment and to create use cases. It's an imperative, because otherwise we will lag behind. My fifth point relates to the fact that please, what the products that we make need to be ABDM enabled or compatible, whichever word you would like to use. Our platform of ABA has to be applicable wherever it is to be applicable. Our ECR systems have to be compatible wherever they have to be compatible. I am not propagating at all the fact that such missions have to look at everything that's being done. No. Use cases, freedom, we don't want to ask us. Validation, yes, that's a different thing, and independent validation. So ABDM system is really not there to control karo roko, no. Lekin compatibility, because that is one job and one imperative that the country has, because it will all bring it together. The sixth suggestion is really about going beyond capacity, targeted adoption. Can there be a systematic approach of saying that the things that work and are validated, can we facilitate their adoption? Adoption, little more than capacity, little more than training. Training is an integral part. लेकिन ऐसे product जो अच्छे बन जाए, how do we help those things to be adopted by our own sector, private sector, छोटे nursing homes, public health system, together for the entire system where the connections have to be for continuum of care, for example, for PM Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, and so on. So systematic, targeted adoption where we have a clear consensus. It's a product that works, it's valid, it must be used. How can we take it to scale? Because And that's my last statement. Because what I'm told in the AI discussion high-level circles and system, particularly as I mentioned at NITI, the nation that will adopt AI will perhaps gain more, and not necessarily those who only create. So it is the adoption of technology which will give the societal dividends, and therefore, how can we make sure that targeted adoption of the tools that work for education, for assisting the doctor, etc., can be used? But I warn again once more, if my AI assistant misguides me and makes a wrong diagnosis, who is to be penalized? I have a very serious concern on that because this gets trivialized. आता है सब कुछ बता देगा, हिस्ट्री लिखेगा, आपको डायग्नोसिस बताएगा. वो तो मेरी किताब में भी था, 6 के 6 वो लिस्ट कर वहीं से तो उठा रहा है. आप ही ने कहा वहीं से कॉपी करता है वो AI, अपने से तो नहीं बना रहा. बट वो बोलेगा इसको कैंसर है, जबकि उसको तो सिर्फ बुखार है, खांसी, अपर रेस्पिरेटरी इन्फेक्शन. So thus it goes back to that accuracy of what it is trying to intend, and so those pathways should be done. But targeted adoption, systematic adoption, scaling of the tools that work are one important imperative where I think we all should work together. But as we said, this is the biggest disruptor, and it's a collective wisdom of all stakeholders is a must, and I'm so honored to be here for a wonderful session. Thank you very much. Okay.
Thank you very much, sir. And it's always our pleasure to hear you. And thank you for your enlightening word and putting forward a vision for how AI could really revolutionize the Indian healthcare system. Thank you very much, Kiran, sir. And thank you very much, all the esteemed panel on this dais for joining us today. And thank you very much to all our industry leaders sitting here in this room for joining us and participating in this very interesting topic. Thank you very much for the session. Over to you.
Thank you so much, sir, for wonderfully conducting and concluding this session. Thank you so much, honorable experts. Ladies and gentlemen, with that, we conclude this session, and I would request all of you to kindly join us at the third floor in the Commission Hall. We've been indicated that our honorable minister is on his way and should be joining us shortly. May I request a moment for all our members on the head table to kindly just give us a moment for a group photograph. May I request the experts onto the stage for a group photograph, please? And in the meanwhile, may I request everyone present in the hall to kindly join us in the Commission Hall? Thank you so much. Warm welcome, ladies and gentlemen. May I request everyone present in the hall to kindly settle down. And I also request all our guests, our special invitees, our delegates who are outside the hall. Ladies and gentlemen, can we put our hands together as we welcome our Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, Government of India, Shri J.P. Nadda ji. Once again, I request everyone to kindly put their electronic gadgets on silent mode. May I request everyone to kindly settle down. Thank you so much. Namaskar, good morning, Swagatam, ladies and gentlemen, esteemed guests, distinguished speakers, partners, and delegates. It's an absolute honor and a great privilege to have with us Honorable Union Minister for Health and Family Welfare and Chemicals and Fertilizers, Government of India, Shri J.P. Nadda ji. May I request you all to kindly put your hands together. Sir, आपका अभिनंदन. बहुत स्वागत sir आपका. On the days, we've also been joined by Honorable Member Health Niti Aayog, Government of India, Professor V.K. Paul. Namaskar, sir. We also welcome on the days President Ficci, Mr. Harshavardhan Agarwal, Chair Ficci Health Services Committee and Founder and Chairman Mahajan Imaging and Labs, Dr. Harsh Mahajan, Chair Ficci Swasth Bharat, Public Health Task Force Executive Chairman, Dr. Lal Pats Limited, Managing Trustee, ALVL Foundation, Honorary Brigadier Dr. Arvind Lalji. We also welcome Founder and CEO, Huma Therapeutics UK, Mr. Dan Vadet. Warm welcome to you. And on the days, we've also been joined by Managing Director and CEO, India and Neighboring Markets, Roche Pharma, Ms. Raji Medwan. Warm welcome to you, ma'am. We also welcome Co-Chair, Ficci Health Services Committee, MD Quality Care India Limited, Mr. Varun Khanna. And on the days, we also have Co-Chair, Ficci Health Services Committee, Group Medical Director, Apollo Hospitals Group, Dr. Anupam Sibal. Once again, a very warm welcome to Ficci's Heal 2025. Welcome to the ministerial session, something that we all have been looking forward to. Ladies and gentlemen, Ficci Heal serves as a premier platform where CEOs, entrepreneurs, technologists, policymakers, and healthcare leaders converge to come together to this platform innovations with lots of innovations and share best practices. With the 2025 theme, Care at 25, Defining Moments in Healthcare, the conference reflects on India's healthcare journey over the past 25 years while charting the path ahead. It emphasizes that healthcare is not just a service, but a cornerstone of nation building, where innovation, equity, and sustainability will define the next leap towards a healthier and developed India. Without any further ado, may I request Mr. Harshavardhan Agarwal, President Ficci, to welcome our Honorable Minister Shri J.P. Nadda ji of Health and Family Welfare and Chemicals Fertilizer by presenting a green certificate and a shawl from Ficci. With this green certificate, ladies and gentlemen, we pledge to plant a thicket of trees at the trees of ecotourism, Songmo, Sikkim, India. Together, we thank Honorable Minister Sir for joining us today, despite his extremely busy schedule. Thank you so much, sir. Thank you once again. May I now request Dr. Harsh Mahajan to welcome Professor V.K. Paul, the Honorable Member Niti Aayog, Health, Government of India, with a green certificate and a shawl. We extend our heartfelt gratitude to Professor Paul for his gracious presence today. Presentation of green certificate. I now request Mr. Varun Khanna to kindly welcome Mr. Dan Vadit, founder and CEO of Huma Therapeutics. Warm welcome to you, sir. We welcome him with a green certificate. We deeply appreciate Mr. Dan Vadit's presence and his contribution to this session. I now would request Dr. Anupam Sibal to welcome Ms. Raji Medwan, Managing Director and CEO, India and Neighboring Markets, Roche Pharma, with green certificate. We sincerely thank you, ma'am, for joining us on this occasion. A heartfelt gratitude to you. Thank you so much. Ladies and gentlemen, with this, I request Dr. Harsh Mahajan, Chair Ficci Health Services Committee, founder and Chairman Mahajan Imaging and Labs, to deliver the welcome address.
Good morning. Honorable Union Minister for Health and Family Welfare, Chemicals and Fertilizers, Government of India, Shri J.P. Nadda ji, Professor V.K. Paul, Honorable Member Health, Niti Aayog, Government of India, Mr. Harshvardhan Agarwal, President Ficci, Brigadier Dr. Arvind Lal, Chair Ficci Swasth Bharat Task Force, Mr. Dan Wahdat, Founder and CEO, Huma Therapeutics, Ms. Raji Medwan, Managing Director and CEO, India and Neighboring Markets, Roche Pharma, Mr. Varun Khanna, Co-Chair Ficci Health Services Committee and Managing Director, Quality Care India Limited, Dr. Anupam Sibal, Co-Chair Ficci Health Services Committee and Group Medical Director, Apollo Hospitals Group. Esteemed guests, partners, ladies and gentlemen, it is a profound privilege and an honor to welcome all of you to the Ministerial session at the 19th edition of Ficci Heal. For almost 2 decades, this convergence has served not merely as a conference, but as a crucible where policy, innovation, and partnership merge to define the future trajectory of Indian healthcare. This year's Ficci Heal is centered around the theme, Care at 25, defining moments in healthcare. The theme not only commemorates 25 years of transformative growth in Indian healthcare, but also sets the vision for the next 25 years as we reflect on the journey so far, chart the way forward, and deliberate on solutions to build a healthcare system that is inclusive, patient-centric, and globally benchmarked. Over the past 25 years, India's healthcare sector has undergone a remarkable transformation, emerging as one of the largest and most dynamic in the world. The country has made extraordinary progress in expanding medical infrastructure, increasing access to affordable care, and strengthening public health systems. Under the visionary leadership of Honorable Prime Minister Shri Narendra Modi and the proactive guidance of Honorable Union Health Minister Shri J.P. Nadda, landmark initiatives have been implemented that are reshaping the healthcare landscape. Flagship schemes such as Ayushman Bharat, Pradhan Mantri Jan Arogya Yojana, ABPMJ, have provided over 42 crore Ayushman cards and more than 9.5 crore hospital admissions, the world's largest government-funded health protection scheme. 1.79 lakh health and wellness centers, Ayushman Arogya Mandirs, are poised to take care of preventive and primary care of each citizen of our nation. Programs like Mission Indradhanush have ensured immunization coverage of over 90% of children across the country, significantly reducing vaccine-preventable diseases. Investments in medical education have led to a surge in number of medical colleges. India had about 387 medical colleges in 2014, which has more than doubled to 809 by this year. Digital innovations like the Ayushman Bharat Digital Mission, ABDM, with over 81 crore Abha IDs already given, CoWIN, which delivered more than 220 crore COVID-19 vaccinations, and eSanjeevani, with over 41 crore patients served through teleconsultations, have accelerated healthcare delivery and connected even remote populations to quality services. Together, these advancements have set India firmly on the path towards universal, inclusive, and technology-driven healthcare. As we look ahead, the next 25 years of Indian healthcare envision a future where quality care is truly universal, accessible to every citizen regardless of geography or income. India aims to drive innovation through advanced medical technology, digital health platforms, and artificial intelligence, integrating preventive, promotive, and personalized medicine at every level. Since yesterday, as many of you have seen, at this Ficci Heal platform, we have witnessed truly insightful and engaging discussions on India's healthcare journey and its global impact. The conference has brought together pioneers, the legends, industry leaders, policymakers, and innovators who reflect on defining moments that have shaped India's healthcare system over the past 25 years. These discussions highlighted leadership lessons, policy shifts, and transformative initiatives advancing access, affordability, and quality. We were profoundly honored to host the 17th Ficci Healthcare Excellence Awards last night with Shri Rajiv Gauba, former Cabinet Secretary and now member Niti Aayog, Government of India, as our esteemed chief guest. The awards served as a definitive recognition of champions driving innovation, impact, sustainability, and scalability in the healthcare sector. Today, we will also be releasing in this session a series of comprehensive knowledge papers, Ficci EY paper on true accountable care, advancing quality and viability in Indian healthcare, Ficci Chase Advisors paper on unlocking the longevity dividend, active and healthy aging in India, and finally, Ficci KPMG paper on AI in healthcare, reimagine care with AI-driven transformation. In fact, we had a great session before this particular session on that very theme. These papers are the outcome of months of dedicated research and collaboration and chart a clear course for the future of Indian healthcare. We hope that the government as well as industry members will consider our recommendations and solutions presented through these papers. Sir, one of our long pending and key reform asks has been the increase in public spending on healthcare, which has indeed, under your leadership, increased over the last few years, but we need to raise it to more than 3% of GDP to help in sustained upgradation of our primary health system as well as for further reducing out-of-pocket spend. Further, as the government brings in huge GST reforms, which is a landmark achievement, including for the medical sector, we request you to consider zero-rated GST for healthcare facilities, as due to their exemption from GST, we are unable to claim the input tax credit on the services that are availed by patients, leading to higher costs of care. Sir, we once again assure you that the healthcare sector is committed to supporting the government in achieving its vision of universal healthcare for all Indians. Through continued investments in innovation, infrastructure, and human resources, the industry stands ready to partner with policymakers in expanding access, improving quality, and building a globally competitive health system. Today, as we surge ahead, I urge every delegate, thought leader, and partner to engage in further deliberations with the highest spirit of collaborative action. The defining moments of the future are not inherited, will never be inherited. They have to be co-created. Let us ensure that Care at 25 sets the unshakable foundation for a healthy, resilient, and prosperous India. Thank you all very much.
Thank you so much, sir, for setting the stage with your very insightful words and offering such a warm welcome to all the attendees. I now welcome Mr. Harshvardhan Agarwal, President Ficci, to share his remarks on the significance of this conference as well as the healthcare sector for India.
Honorable Minister, Shri J.P. Nadda ji, Professor V.K. Paul, Honorable Member Health Niti Ayog, Honorable dignitaries on the dais and off the dais, a very good morning to all of you. On behalf of Ficci, I warmly welcome all of you on the 19th edition of Ficci Heal 2025. We are deeply honored to have visionaries and leaders who continue to shape India's healthcare transformation with us today. This year's theme, Care at 25, Defining Moments in Healthcare, is more than a title. It is a vital call to action. It serves two critical purposes. First, as a commemorative marker for the 25 years of transformative growth since the turn of the millennium. And second, and more crucially, as the launchpad for the next chapter of our health journey towards Viksit Bharat by 2047. The past 25 years have witnessed remarkable milestones. The National Health Mission, Ayushman Bharat, and over 800 million HABA IDs have created the world's largest publicly funded health coverage system. The recent GST reforms, reducing rates on medicines and medical devices from 12 to 18% to just 5%, have made healthcare significantly more affordable for millions. India now stands as the world's largest vaccine supplier and a leading manufacturer of generic medicines. Our healthcare professionals serve pivotal roles globally, while our medtech sector emerges as a dynamic hub for innovation and affordable solutions. Public health expenditure has also risen from 1.28% of GDP in financial year 19 to around 2% in 25, with the industry projected to reach $, around 640 billion by 2025. The rising burden of non-communicable diseases, our aging population, and persistent rural-urban disparities demand urgent attention. Reducing out-of-pocket expenditures, currently among the highest globally, remains critical. The next 25 years must harmonize accessibility, quality, innovation, and sustainability, ensuring no one is left behind. We must also shift from sick care to health care, embracing preventive health as our primary strategy. The Ayushman Arogya Mandirs and the wellness centers represent this philosophy, but we need deeper penetration of preventive screenings, lifestyle intervention programs, and health literacy campaigns. As the saying goes, prevention is better than cure, and in India's context, it's also more affordable and sustainable. Every rupee invested in prevention saves 10 in treatment cost while dramatically improving quality of life. As our Honorable Prime Minister Shri Narendra Modi ji said, a healthy India is the foundation of a developed India. Healthcare is not an expense, it is an investment in human capital. The Ficci Health Service Committee has partnered with government for 2 decades, advancing standardization, medical education reforms, and shaping transformative programs like Ayushman Bharat and National Digital Health Ecosystem. I acknowledge our leadership who are guiding and shaping India's healthcare ecosystems and countless others who drive our healthcare initiatives forward. As we celebrate Care at 25, let us recommit to building an inclusive, resilient health system. Together, government, industry, and caregivers, we will shape the next era with equity, excellence, and compassion at its core. The recent GST relief for health insurance premium exemplifies responsive governance. The digital health market's projected growth to US 53 billion by 2030 signals immense potential. These are not just statistics, they represent millions of lives touched, families protected, and futures secured. May these deliberations inspire actionable solutions for a Swasth and Viksit Bharat. As we embark on this defining journey, remember, healthcare transformation is not the work of government or industry alone. It is our shared national mission. I wish Ficci Heal and all the participants a tremendous success, and once again, I welcome our Honorable Minister Shri J.P. Nadda ji today. Thank you so much. Namaste.
Thank you so much, sir, for sharing those achievements and the role played by Ficci and its members for this important sector. Ladies and gentlemen, we now are going to invite a global recognized public health expert and medical scientist. We are very deeply honored to have with us Professor Vinod K. Paul, member Niti Aayog, Government of India, to kindly guide us with his words.
Namaskar, good morning. Honorable Union Minister of Health and Family Welfare and Chemicals and Fertilizers, Shri Jagat Prakash Nadda ji, respected Shri Harshvardhan Agarwal ji, President Ficci, dignitaries on the dais, dignitaries in the hall, distinguished colleagues. It's an honor to be here. Ficci Heal is an iconic event which all stakeholders look forward to. I congratulate Ficci for the profound work that you are contributing toward India's progress and development. We are all united in our efforts, individual and collective, to achieve the highest aspiration of a Viksit Bharat at 2047. And all sectors, all stakeholders, all of us individually and as professionals have the onus on us and the motivation and commitment to work in that direction. And I think that's one resolution that we all share in this room. Viksit Bharat at 2047, on the one side, is about a $30 trillion economy. That's one imperative. The second imperative, in terms of our sector, is to raise life expectancy from the current level of 71 years to 85 years or more, healthy life expectancy from 60 years to 75, because these are the benchmarks of the developed nations of the day, and that's what we all have to strive. And therefore, I urge, keep this ultimate imperative in mind: saving lives, prolonging lives, and ensuring healthy lives, not just long life, but a healthy life. In that context, and in the presence of the Honorable Minister, sir, I wish to bring to your kind attention 2 points. First, we will surely need more hospital infrastructure. Our current hospital infrastructure, in terms of beds, let's say, is about 1 per 1,000, roughly 1 per 1,000, a little more than 1 per 1,000. Developed nations have this ratio of surely always above 2, even 3, and in some countries even 4. It is also possible that the way health system is emerging, home care may become very important and so on, but I don't see a future without having to achieve at least 2 beds per 1,000 as a proximate goal that we should all work. 2 to karna hi hoga. Today we are about 15 lakh beds. So to reach 30 lakh beds is an imperative that I think is looming large in front of us. Let's say 10 lakh beds out of that will come from the private sector. I urge you to think about how we will achieve that. And because health is an enabler for a Viksit Bharat, as well as a result of Viksit Bharat, we have to be a party to healthy workforce and healthy citizens so that they achieve Viksit Bharat. Therefore, I urge that we think about how these extra 10 lakh beds can come from the private sector in the next 10 years. And in that regard, the Honorable Prime Minister has given a call for deregulation. I give a call to you that Niti would be extremely looking forward to your suggestions on how this sector can be deregulated in terms of establishments, in terms of blood bank, in terms of systems, and so on. And my distinguished colleague, Shri Rajiv Gabaji, is chairing a committee. We'll be very happy to receive your suggestion, and for that, the time is now. And that will then pay for not only expansion of the infrastructure, but other aspects of the healthcare. So this is my first submission. My second submission, Honorable Sir, in your presence is that we are moving forward with expansion of our workforce, undergraduate seats and the postgraduate seats. The way we are moving forward, we are seeing an exponential and rightful rise of our specialist doctors. We are moving very much into it. My concern is, and the concern from academia is, what happens to general practice and family medicine? One scenario would be that we'll have specialists and specialists and specialists and a small space for MBBS doctors who will provide the general practice. And that will be shrinking because aspiration for every doctor to be a specialist cannot be denied. We need to bring in, my suggestion, the discipline of general practice or family medicine. Let's call it family medicine. And we need to work with you to bring that paradigm. I think all of us need a general family doctor who looks after from newborn period to geriatric. In fact, for geriatrics, it's even more important. And internal medicine is not equivalent to general medicine, general practice. Community medicine is not family medicine. Please, we would need a discussion. And what I'm saying is, as an imperative enshrined in the National Health Policy 2017, and it is enshrined in the NMC Act as a specific sub-clause to facilitate and promote the discipline of family medicine. I urge that we need discussion in that regard. Otherwise, we are seeing a scenario where there is fragmented care. For everything you need to, every person may need to go to 5 people, and that's not the best thing. And a corollary of that is, would the large hospitals, your hospitals, start with family health, general practice clinics as well, in addition to the specialty care, because we need to have the demand side also to be taken care of, both in the government as well as in the private sector. These are my 2 humble submissions on this auspicious day, and celebrating the journey of Ficci in contributing to health care of the people of India. Jai Hind. Thank you.
Thank you so much, sir, for your inspiring words and for your continued leadership in shaping the future of healthcare in India. We deeply appreciate your time and the support that we get from you. Thank you so much, sir. Ladies and gentlemen, we have now reached to a very momentous moment, and I am talking about the release of the knowledge papers. Ficci continues its tradition of knowledge sharing through comprehensive research papers. We are privileged to release several critical publications today. And I request our Honorable Minister, sir, and our Honorable dignitaries on the dais to kindly release our first paper, which is the Ficci EY Parthenon Report, True Accountable Care, Maximizing Healthcare Delivery Impact Efficiently. May I also request Mr. Varun Khanna, who's been the driving force behind this, Mr. Ashish Nanda, who's the Managing Partner, Consumer Products and Health Service, EY India, Mr. Kaivan Modwala, Partner and Healthcare Sector Leader, EY Parthenon, India, and Mr. Akshay Ravi, Partner, EY Parthenon, who have led this report to kindly join us onto the stage. And ladies and gentlemen, may I request you to kindly bring in some energy by putting your hands together as I request Honorable Minister, Sir, and our distinguished members of the dais to kindly join us for the release. This is a very momentous moment for all of us. All our hard works, all our mission is coming to this very moment as a special moment for all of us. The report addresses a fundamental question: how can India deliver healthcare that is accessible, affordable, and accountable at scale? Many congratulations to this team, and I thank our Honorable Minister for doing the honors. Once again, may I request you all to kindly put your hands together and bring in some energy. Thank you. Thank you so much. We now move to our next release, and it is the Ficci Chase Advisors paper, Unlocking the Longevity Dividend, Active and Healthy Aging in India. May I also request Dr. Arun K. Agarwal, Chair of Ficci Task Force on Active and Healthy Aging, Ms. Malti Jaiswal, Co-Chair Ficci Task Force on Active and Healthy Aging and Founder Inspiring Seniors Foundation. May I also request Mr. Nikhil Khanna, Executive Chairman, Chase Advisor, to kindly join us onto the stage, and I request our Honorable Minister, Sir, and our Honorable dignitaries on the dais to kindly release this paper, the Chase Advisors paper, Unlocking the Longevity Dividend, Active and Healthy Aging in India. This is a very special moment for all of us, ladies and gentlemen, and we request you all to kindly participate by once again putting your hands together, bringing in some energy, and being part of this celebration. Thank you once again. Thank you once again. We now move to our next release, which is the Ficci KPMG paper, AI in Healthcare, Reimagine Care with AI-Driven Transformation. It is my pleasure to invite Mr. Lalit Misri, who is the partner and co-head Healthcare Sector KPMG Advisory Services, to the stage for the release. May I request our Honorable Minister, Sir, and our honorable dignitaries on the dais to kindly release. May we also request Mr. Kabir to kindly join us onto the stage, Mr. Kabir Mahajan to kindly join us onto the stage for the release. Ladies and gentlemen, a huge round of applause. We bring in energy together to celebrate this moment. This has been a huge task for all of us, and we wish to celebrate with each one of you present here. Thank you so much, Honorable Minister, Sir. Thank you so much, Honorable dignitaries, for releasing the Ficci papers. We now move to a very, very special moment that we all have been waiting for. We are today very deeply honored to have with us Shri J.P. Nadda ji, who is the Honorable Union Minister for Health and Family Welfare and Chemical and Fertilizers, Government of India. We all know him as a very senior, dynamic national leader with a distinguished career in public services. So we're very honored to have you with us this morning. May I request you to kindly bless us with your words.
Professor V.K. Paul ji, the Honorable Member of Niti Aayog, taking care of the health. Mr. Harshvardhan Agrawal ji, the President of Ficci. Harsh Mahajan ji, my friend Dr. Arvind Lal ji, Mr. Dhan Wahadat ji, Madam Raji Mehdavan ji, Mr. Varun Khanna, Dr. Anupam Sibbal, members of Ficci, distinguished guests, leaders from the industry, policy makers, and very distinguished representing the various medical organizations and taking care of the healthcare. my friends from the media, print media and electronic media. It is indeed a privilege for me to be here for the Ficci Heal 2025 and the coming together of the policymakers, the health experts, the innovators, the industry leaders, and the theme having that care at 25, defining moments in the healthcare. This theme itself is very relevant and very timely and apt that we are discussing about the care at 25. If we have to target to have a healthy India and a Viksit Bharat in 2047, it becomes very important that we should start thinking in those terms, that how do we go forward step by step and what is the roadmap which we are going to have. The target is to have a equitable health, affordable health, accessible health, and if this is the target, we all should join hands and see to it that all together how we can achieve this goal and go forward. The thought process, I always say that it is very important the role of policymakers, how policymakers bring a difference. You will also agree with me, as Dr. Harsh Mahajan in his speech he has said, that in the past decade, a lot of attention has been given to the social sector and especially to the health sector. This doesn't mean that I should say that previously, before 10 years or 11 years, it was an ignored area. No. But the priority, the prioritization was important. And in prioritization, how do we think, how do we go forward? That is very important. And what is the roadmap which we take? In the past 10 years, I can say that after 1997, when we had the health policy, in 1998, it was in 2017 that we developed a new health policy. Now, this health policy was not decided or discussed in Nirman Bhavan. This was discussed with all the stakeholders. We had regional conferences, we had conferences in the states, we had discussion with all stakeholders, and after immense consultation and keeping the health policy basics in public domain, we came out with the health policy of 2017. Now, that is a landmark health policy in the sense it brings a change. What is the change? Previously, we were thinking in terms of only curative health care. It was in 2017 that we started thinking a comprehensive health care. पहले हम सोचते थे बीमार पड़ा तो इलाज कराओ. हमने सोच बदली कि बीमार पड़े क्यों? Why should anybody, we should have a promotive health care. We should have preventive health care. And we should have early detection. So with this, we developed a comprehensive health policy. I'm discussing this because for the last, since yesterday, you have been discussing about the best practices which you have been undertaking and sharing the best practices. But now when I come, it becomes my primary responsibility to share with you what is the thought process of government and the policy makers and your contribution into it. How do you contribute into it? So then comprehensive health policy, we develop preventive health care, promotive health care, palliative health care, curative health care, geriatric health care, and very important part was early detection. When we say accessible health care, तो access कहाँ मिलता है? Where is the contact point? So we expanded the base of health care. And for that, we developed 1.7 lakh Ayushman Arogya Mandir, which is the first contact. And in that contact, we tried to see to it that we are able to give them equitable health care, affordable health care, and accessible also. So we developed a scheme which we called as a community health officer, in which there is a community health officer, doctors, nurses, and that is the first point of contact. Now, when I talk, I also would like to share with you that this Ayushman Arogya Mandir has got 12 kinds of packages. We take care of eye and ENT, early detection of eye problem, ENT, ear, nose and throat. We take care of the dental care. We take care of the mental care. We take care of the hypertension. We take care of the diabetes, so that the early detection takes place. But the most important, which I would like to share with you, that we also provide free drugs and diagnostic facilities. And I would also like to share, because Niti Aayog is doing the third party audit of how the diagnosis and drug facilities are being provided to the common man. But the most important was the reproductive and child health care. This is one of the very important aspects for a healthy India when we are going for 2047, for a Viksit Bharat. And when I say so, I would like to share with you, because these things generally people don't know, or maybe if they know, they are not able to understand the importance, not I'll say importance, but the how it is bringing the change in the Indian health system. Every woman who gets pregnant, she is tracked by our system, which is called a mother and child tracking system by ASHA workers. Every woman. The day she conceives, from that very day, it is mandatory to have 5 antenatal checkups. And all this is captured. When she got her first checkup done, when she got her second checkup done, when she got third checkup done, in which month, all is captured digitally. And she has to be seen by one specialist in the whole process of before delivery. Another thing which I would like to share with you, that for high risk patients, it is mandatory to have 8 checkups, in which 3 checkups has to be done by specialists. All is captured by mother and child tracking system. We have a cohort of more than 5 crore mother and children. 5 crore at any given time. See the number and see how it brings the difference. So 8 checkups for high risk patients, 5 checkups for normal pregnant women. And then if I talk about vaccination, from child to 16 years, from the birth to 16 years, जब जन्म लेने से 16 साल तक. For 12 preventable diseases, we have 11 vaccines and 27 doses are given to them. And again, this is also tracked every month with an alert system. Every year. For 16 years it is tracked. Now you can understand that what policy makers have brought the difference for a healthy India. कि अगर हमको 27 वो डोजेस देने हैं और 16 साल तक उसको ट्रैक करना है बच्चे को, तो इट्स एंड यू हैव टू डू इट डिजिटली, so that you are, and if the mother does not come, or the boy does not come, or the girl does not come, the young child does not come to the facility, there is an alert system which alerts, and the ASHA worker has to go and remind her or him that you have to come and get vaccinated. And you have to ask the mother and the father of the parents of the child to see to it. So this is how we are trying to see that, and what difference it has brought. According to the National Family Health Survey, the 79% institutional deliveries have increased to 89, means 90%, reaching 90% institutional deliveries. Now how it is done? It is the responsibility of the ASHA worker to take the patient to the institution, get her delivered. If there is a complication, see to it that a complication which is being taken care by the government institution, and bring the patient back to home. Transportation is free. Incentives are given to ASHA workers for each delivery which she gets done in the institutional delivery. And this is because now we are reaching 90% of institutional deliveries. If I talk about MMR, maternal mortality ratio, according to the SRS, it was 130 per lakh childbirth, and now it is reduced to 88 per lakh live births. 88. There 42 there is a reduction in 42 points, which we have to understand. And all this has taken in just 10 years, in the past 10 years. And this figure I'm giving is in 2021, not in past 10 years, in past 8 years. And now the figures will be much more encouraging if I talk about. If I talk about the infant mortality rate, it was 39 per 1,000 live births. Now it is 27 per 1,000 live births. And under 5 mortality, the decline is 42%. And the global decline is 14%. So you can understand that how India is answering the basic questions of the healthy child, and how we have to see to it that if I talk about neonatal mortality, the decline is 39% and the global decline is just 11%. That means with the speed with which India is going forward in the decline of the infant mortality rate and the neonatal mortality, that we have to understand. Of course, WHO has now also given a certificate to us that trachoma is no more a public concern, and very soon, 1 year is left, we will be also out of the Kala Azar. This is the 3rd year of the where we are keeping an eye on it, and we will be very soon out of Kala Azar. If I talk about tuberculosis, now this is also a very big public health problem challenge. Now, according to WHO, the decline of tuberculosis in India is 17.7%, and the decline globally is 8.3%. Means our decline is more than double of what is the global decline. And if I talk about the treatment was 53%, and now the treatment has increased to 85%. And if I talk about the Lancet report, the Lancet report says that within 10 to 15 days, and the moment the person is detected with tuberculosis, the treatment starts at that very moment, that we have to understand. So this is how the change is being brought forth. Harshji also talked about the Ayushman Bharat. I become emotional when I talk about Ayushman Bharat because I am associated with it. What happened, I became the first time the health minister, it was in 2014. And India got the opportunity to chair the World Health Assembly. So I chaired the World Health Assembly in 2015. And at that point of time in World Health Assembly, the discussion was about the UHC, Universal Health Coverage. And I thought whether India will be able to, I'm chairing the World Health Assembly and we are talking about universal health coverage. Will India be able to give this universal health coverage, and how we can go forward? I came back, I made a plan, I went to Prime Minister Modi ji and I said that this is the plan. He told me, think something big. You are doing something, don't think in tits and bits, think big. And then we came out with Ayushman Bharat, which becomes the world's largest health coverage program. It is the world's largest health coverage program and health assurance program. And I would like to correct the figures. Now it is 62 crore people, almost more than 40% of the Indian population, which is covered with a 5 lakh rupees of health coverage. And now very important part is that every person above the age of 70 is entitled for a Ayushman coverage till death. You see, even the insurance company don't give you insurance after 60, 70. They also discourage. But our assurance starts only after 70 to all men and women and to all sections of the society, and without any financial distinction or giving them from any financial background is entitled for having this Ayushman Bharat. And if I talk about approximately 32,913 empaneled hospitals are there. And there, of course, when the scheme goes on, there are issues. which issues has to be addressed time and again, and it is a continuous process. And here, where I'm here with the private institutions, I assure you that certainly we are taking care of that also, and we are very much in the process of taking care of whatever the problems to come in the scheme. But this is the world's largest healthcare scheme, which we have to understand. If I talk about even in GST on 22nd September, the insurance part has also been taken care, and now we have got zero GST on the health insurance part, that we have to understand. If I talk about affordability, yes, Amrit Pharmacy, more than there are 240 outlets, and 6.62 crore patients have taken the advantage of it, and they have had the savings of 8,000 crore rupees as far as the branded medicines are concerned, where the rates are 50% less in Amrit Pharmacy. Amrit is the affordable medicine and reliable implant treatment program which we are trying to go forward. If I talk about Jan Aushadhi, we have got 16,000 outlets, and we are going to increase it to 25,000 outlets, and more than 38,000 crore savings have been given to the patients. This is how we are trying to see to it that how we can help the patients, and give them a helping hand. If I talk about the decline in the out-of-pocket expenditure in the past 10 years, from 62.6%, the decline is now to 39.4%, the out-of-pocket expenditure. And Ayushman Bharat has played a very important role in this process. If I talk about the medical infrastructure, of course, I agree with Professor V.K. Paul that we need 20 lakh beds in coming times if we have to match with the Viksit Bharat, and at least 2 beds per 1,000. That is the target we have to set. But we have, as far as the medical institutions are concerned, of course, we need doctors also. On the doctors front, as Harshji also said, at one point of time, we had only, by the end of this last century, we had only one All India Institute of Medical Sciences. Atal Bihari Vajpayee ji, the Prime Minister, created 6 All India Institute of Medical Sciences. And now we have got 16 plus 23 medical All India Institute of Medical Sciences, state of the art, that is being created. And as far as medical colleges are concerned, at one point of time there were 387 medical colleges. Now we have got 810 medical colleges, and the seats were 51,000. Now we have got 1,25,000 UG seats, and very soon we will be having, in next 5 years, 75,000 UG and PG seats increase in the next 5 years. And if I talk about the PG seats, it was 31,000. Now it is 76,000. So, and the last year, 16,000 seats have been increased. And we are trying to see to it that the quality does not get compromised, and we increase the quantity also, because that is the need of the hour. And along with that, the paramedic staff has also to be taken care, and so on that account also we are working that each medical colleges should have at least matching paramedical courses which we have to give. As far as digital India is concerned, you will be very happy to note that even America gives a certificate of corona on a paper, and you get a digital certificate, and this is how we say that India is a digital India. Aadhaar card, as Harshji told, that 81 crore Aadhaar cards have been made, Ayushman Bharat health account, and more than 74 crores Aadhaar health records have been linked with Aadhaar card. So now the patients are not supposed to take all their documents. They are only to take their Aadhaar card, and they can share with the doctor. This is how we are working. As far as the e-Sanjeevani is concerned, it is providing teleconsultation from provider to provider, from doctor to doctor. And this is being linked with the medical colleges, and this is how we are working. As far as the e-Sanjeevani OPT is concerned, the consultation is between the patient and the provider, and this is how we are trying to see to it that digital India, through digitally we are able to take care of the patients and give them the prescribed medicines which are needed for them. As far as UWIN portal is concerned, it has got a self-registration system for appointment. It has got QR-based vaccine certification. It has got SMS alerts for due doses, as I said, for mother and child trafficking system. And this is being translated into 12 languages. This is how we are working. And approximately 12.8 crore have been registered, and 52.5 crore doses have been recorded in the UWIN portal. So India is trying to see to it, and the Ministry of Health and Family Welfare is trying to see to it, that in the field of health, how digitally we can give relief to the patient and how digitally we can take care of them. That is how we are trying to see to it that this health program works. As far as the expenditure part is concerned, I would like to share with you, we are very clear about it, that the 2017 policy says that we will be spending 2.5% of the GDP for the health sector, and we are now 1.8%. 1.8% we are spending on it. Here also I'd like to share with you, funds is not the problem. Problem is the expenditure. The states should have the capacity to spend. Now we have, in the past 5 years, we have given 86,000 crores for PM Abhim, PM Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. We have given them 65,000 crores, 86,000 crores. But as far as the expenditures is concerned, I have to chase the states. Bhai, kharch karo. Kharch karo. So we have to increase the capacity of spending. It's not that we can't put the money down the drain. It has to be spent on health in the right perspective. So therefore that is one challenge which we face. And yesterday also in the National Health Mission, I had to talk to 3 states. But you are not spending your money. Utilization certificate is not coming. And so next year your program implementation plan is going to suffer. So funds is not the problem. Problem is of implementation, and problem is of the rightful usage for which the states have to respond. We are trying our level best, but this is the issue. So there should not be in mind that India ka Bharat mein wo paisa ka bada problem. No, nothing. ये माइंड से आप निकाल दीजिए. खर्च करने वाले बनिए, हम तैयार बैठे हैं. राइटफुल खर्च करना है. ये कॉशन जरूर है कि राइटफुल खर्च करना है, नहीं तो कल को छपा होगा खर्च करो हम तैयार हैं. तो इसलिए मैं आपके माध्यम से अपने शब्दों में कॉशन के साथ इस बात को कह रहा हूँ. As far as the 2 issues which has been raised by Dr. V.K. Paul ji, one is about the deregulation of the beds as far as that is concerned. Of course, the committee is working. We are open to it, and certainly if that is the need of the hour, we will be certainly looking into it. And as far as his concern about the family medicine is concerned, I am also very much concerned about it. It's a very, he has raised the issue very timely, and that has to be addressed, that needs to be addressed. And for that, we will sit with the IMA, the NMC, and all the stakeholders and see how we can go forward in that direction. But this is also the need of the hour, which we have to understand. As far as all of you are concerned, I would like to assure you on behalf of the government that we are open to suggestions. We are open to bring changes so that your best practices do not get hampered, do not get disturbed. And at the same time, I just wanted to share with you what government is trying to do in this field of health, so that we work jointly and understand each other's problems and their challenges and their roadmap. And when we work together, certainly we will be able to take care of a healthy India and a Viksit Bharat in 2047. I once again thank you all for giving me a very patient hearing. Thank you very much.
Thank you so much, Honorable Minister, sir, for those very inspiring words. And we also thank you, sir, for your continued leadership in shaping the future of healthcare in India. And we truly and deeply appreciate for your time and your support today. Thank you once again, sir. Ladies and gentlemen, once again, may I request you to put a huge round of applause as we thank our Honorable Minister, sir. May I now invite Mr. Varun Khanna, who is the co-chair Ficci Health Services Committee and MD Quality Care India Limited, to deliver the concluding remarks.
Good afternoon, everyone. It's an honor to be here after having heard Honorable Minister Shri J.P. Nadda ji, after having heard our own Professor V.K. Paul ji, to kind of give a concluding remark. Let me start with and try and associate what we've discussed yesterday, today, and how Nadda ji has kind of put it. You know, he spoke about multiple things, but I was trying to kind of club them together so that we can see the impact that India has seen, in the last decade or so. If you today look at the growth in talent, and you know, our industry is talent dependent and nothing else. Take a guess, over the next 7 years, how many doctors will India produce? 1 million doctors, give or take. Find me another country in the world which can have 1 million doctors to enable the health system of a country as vast as ours. It's incredible. And we are today, by the way, it's not small today, we are today the largest health workforce in Asia. Now let me go to the next point that I kind of looked at, infrastructure. Our infrastructure progression is significant. We double, to Professor Paul's point, we double our bed capacity every 7 to 10 years. And honestly, and it's also captured, Nadda Sahab, in the EY report on how sustainability of this infrastructure is going to come in. If you see, and I do actually see that there is sight to enable 600,000 to 700,000 beds over the next 7 years, ably supported by the talent that I spoke about. Because you could have a bed, but unless you have 1 doctor to 1 bed ratio, a bed is not worth. So imagine in every other part of the world, crisis is not the bed, crisis is to enable that with talent. And we certainly have sight to that talent, coupled with the bed. I'm reasonably sure that we'll get to the number that Professor Paul spoke about. The next part, I think, adequate, it's the access part of it. Again, access is the same story. From 80% to less than 39% in less than a decade. And I see that improving as we go forward. And the last part I think that I want to touch upon, and I know I'm getting, I'm seeing the eyes of Dr. Mahajan there. It's quality, right? We've taught the world frugality, and we are teaching the word quality with frugality to the rest of the world. And that is something that we are enabling. And I have to thank, sir, your leadership, your vision, and that's enabling all of that to happen. So once again, ladies and gentlemen, let's put our hand together for... Come on, that can be louder, yeah, come on. Thank you, ladies and gentlemen.
Thank you so much, sir, for that very thoughtful and very energetic concluding remark from you. Thank you for reinforcing the importance of our shared goals. Thank you once again. Ladies and gentlemen, a huge round of applause for our Honorable Minister, sir. Thank you so much, sir, for sharing your valuable thoughts and most importantly, your valuable time with us. Thank you once again, sir. Ladies and gentlemen, we would be continuing with our session. I request everyone to kindly remain in their seats. And we thank our Honorable Minister, sir, as he leaves the Commission Hall. And I request everyone present in the hall to kindly retain the seats as we continue with our session. May I request everyone to kindly remain seated now? We continue with our session. I request everyone to kindly remain seated. Ladies and gentlemen, now is the time to pay attention to our global experts. To continue with the session and to hear our global experts, once again, I request everyone in the hall to kindly be seated. Once again, may I request everyone who is outside the hall to kindly join us inside. This is a moment as we are now going to hear our global experts. May I request everyone to kindly settle down, please? It's a huge honor as we now introduce our speaker, who is the Managing Director and CEO, India and Neighboring Markets, Roche Pharma, Ms. Raji Medwan. Ms. Medwan brings over 2 decades of experience in healthcare industry across global markets. She's a passionate leader and very passionate about advancing the healthcare and delivering meaningful medicines and solutions to patients. With those words, may I request Ms. Raji Medwan to kindly share her thoughts with us. Anywhere, ma'am, wherever you can.
And don't cut me short. I don't want the eyes. Hi, everyone. My remarks for transparency were written with the ministers and Dr. Paul in the room. So just roll with me. I'm going to change it up a bit. But yeah, just to share that up front. It's a privilege to be here with you. And it was really inspiring to listen to Mr. Naddaji and also Mr. Paul about all the accomplishments and all the work that the government's doing. You know, I'd prepared a bunch of remarks which actually have all been covered. I was going to talk about the government's work in Ayushman Bharat, the government's work in Arogya Mandirs, but I don't think I can say it any more better than what Mr. Naddaji has already said. And I don't know about how you felt sitting there. I felt inspired sitting there listening to him. I'll share with you a dinner conversation that I recently had. I've lived abroad for quite a bit of my career, and I was with some global friends, and as dinner conversations go, India mein ye theek nahi chal raha hai, wo theek nahi chal raha hai. So you sit there listening, and then you mention to them, we have 600 million Indians now covered by Ayushman Bharat, universal healthcare access. I was met with silence, and then and then we changed the topic. So I think actions speak louder than words. And so it was inspiring to listen to him and say, okay, we just need to keep working at this
and keep going because we have a big mission in front of us. So with that context, I'd like to today talk about equitable access and why that really matters. So when we speak of equitable access, we're not just discussing policies, budgets, infrastructure. At the heart of it, we're talking about people. We're talking about their lives and their hopes. And it's our job to support them end to end. So if you take breast care, for example, 2 decades ago, a breast care diagnosis was a death sentence for a woman. Now, women in India and globally have some of the best survival rates possible. It's almost like a chronic disease. Now, how does that happen? That happens because we've been able to innovate and bring awareness on breast cancer. We've been able to bring the best diagnostics to women, and we've been able to bring life-changing medicines to women across India. That's why equitable care matters. If you take another disease, diabetes, for example, India is the diabetes capital of the world. It's not a statistic to be proud of, but that's the reality of it. And many, many Indians, thousands of them on a daily basis or a yearly basis, are going blind, which is majorly preventable. So 85 million, forgive my statistics, 85% of diabetics don't even know that they are at risk of going blind. And if this is caught early with the right diagnostics, it is utterly preventable. So that's why equitable healthcare matters. And the question is, how can we act fast? How can we bring, as Nadaji was saying, care to the point of care so that we can catch things early, we can treat them early, and in that sense, we improve patients' lives. It's not going to be done just by one person. We all in this room, all entities, governments, private entities like ourselves, physicians in the room, Ficci, other actors, we all have to work together. So it's only going to happen through partnership. And I was sitting there in that seat and I was struck by the words in front of me. Gandhiji, who apparently was here in 1931 hosting Ficci. And what he says there is the industry, and I'm going to elaborate his words to say industry meaning all of us, should regard themselves as trustees and servants. And there's something really humbling about that that resonates with me. We learned lessons around this in COVID-19. This can be done, and this is not new to India. In COVID-19, government of India, governments across the world, private sector, academia, multilateral organizations like ourselves, we all came together, and super quickly, vaccines were developed, diagnostic solutions were scaled up, and treatments delivered in a record time. And for a population of 1.4 billion people, that's no small feat. We, Roche, also did our part when it mattered most. And I offered some of this humbly to you. And again, I say it in the context of partnerships. We brought therapies like tocilizumab and Ronaprevir to patients working with the government, because that was the need of the hour. We delivered over 2 million PCR kits to the Indian Council for Medical Research, and we introduced diagnostic solutions in record times. I remember a conversation at Roche where something used to take us 6 months because of all of our processes. We turned things around in 2 to 3 days. That's possible. And that's possible when there's a mission at hand in front of you and when people come together. The other part I would like to bring attention to is innovation is good, and we need to make sure these diagnostics and these treatments are at the core of our efforts and they're put in the hands of our patients. History has proven that investment and breakthroughs in science and technology, they hold the power to change trajectory in healthcare. And as members of the life sciences community in this room, we strive to deliver best-in-class treatments for every Indian in a sustainable and responsible manner. At Roche, that's our belief. Innovation has been our guiding light, our driving force. Globally, we reinvest 20% of our revenue into research and development. And why that matters? Because it's that commitment that allows us then to bring life-changing treatments, both worldwide and here in India. And to give you some concrete examples, how we are bringing our expertise to strengthen the nation here in India, we launched a Site Air Alliance initiative where we are working with 10 government hospitals here around Delhi and across India to enhance the clinical research capability. We're getting amazing feedback, and the intention is to continue that and invest more in that. We're also championing programs like Startup India and PRIP to help India's leadership in research and development. So look, I can talk about all of this. I can talk about science and technology, the system building, the partnership. At the end of the day, if we don't get it into the hands of patients, every Indian, the job is not done. And this is where I think, though we are making tremendous progress and listening, again, personally, sitting there as an Indian, I was feeling incredibly proud listening to Mr. Naddaji and all the efforts that are being done in this country. There is something to looking to other countries and learning from them. Because one thing we know, if you look at other developed and resilient healthcare systems, one thing stands out. They're built on a foundation of strong and enduring public-private partnerships to unlock access. I spoke about COVID before, but if I can offer another example, it's work actually done by the ministry and private actors. If you look at cataract, Motia, right, 20 years ago, inaccessible to patients across India. Now it's easily accessible at different points of care at a very, very affordable cost. And that's only happened because of the government's intention and investment behind it, because of private actors putting efforts into it, and because of diagnostics. I'm actually really looking forward to your remarks earlier, because I think there's a huge opportunity in how we can bring technology to make a difference in some of these diseases and bring access to patients across. So maybe I'll end at this point. If we can do this, at the end of the day, what's the joint mission? The joint mission is to create a scenario where patients win, they gain affordable access to innovation. Governments are able to deliver these solutions without financial strain, and companies can continue to invest in research and development, paving the way for future breakthroughs. So I'll pause with Mr. Naddaji's vision, Mr. Paul's vision. It's our vision. And as a life sciences community, as Roche, we stand here shoulder to shoulder with the government, with all the other actors to ensure that at the end of the day, no Indian is denied care, no disease remains unconquered, and no patient is left behind. And I'll again end with Gandhiji's words. All of us should regard ourselves as the trustees and servants of all of our citizens in India. Thank you for your time and attention.
Thank you so much, ma'am, for that very inspiring words from you. Thank you for highlighting on how innovation can propel healthcare into a brighter future. Ladies and gentlemen, it is now absolutely an honor for me to introduce our speaker, who is the founder and CEO, Huma Therapeutics, a pioneering global health technology company, Mr. Dan Vaded. And under his leadership, ladies and gentlemen, Huma has become a global pioneer in healthcare, AI, powering national digital health system and transforming how nations deliver care. He has been recognized by the World Economic Forum as a global innovator for his contributions to advancing AI in healthcare worldwide. With those words, may I request you, sir, to kindly share your thoughts with us.
Good afternoon to everyone. It is a real honor for me to be here at Ficci Health 25. I'm also truly grateful for the hard work of Ficci team, and especially Varun, for kindly inviting me. I feel very lucky that I had the opportunity to be sitting with Honorable Minister Nada, Professor Paul, President Agrawal, Dr. Mahajan, Dr. Lal, Dr. Sibal, Ms. Medwan, and the amazing Varun. Now, Varun set the bar really high yesterday for me and for what Huma, my company, can do. But before I tell you anything about Huma, I want to share with you what I've observed in the past 24 hours since I arrived in India for the very first time in my life. I have observed a miracle. And I will tell you why. Everyone thinks Taj Mahal is one of the 7 wonders from India, and that's the only thing. But I think I actually found a new wonder in India, and that is how India delivers healthcare. How much care is being delivered in this country for what cost? This is truly a miracle from my perspective. And this is due to the great work that Minister Nada, Professor V.K. Paul, and all the amazing people in this room, they're doing every day. India has 1.5 billion population. The total budget being spent in healthcare is roughly around $150 billion. If India were running the healthcare in the US, given we have 300 something million people, the total healthcare cost in the US would have been only $40 billion. But the cost of US healthcare is $4 trillion today, and it is growing. It's getting closer to almost 25% of the country GDP. Now, India healthcare is low cost. The quality may be not the most perfect, but it is good. It is accessible for everyone. And when you look into important metrics, lots of stats that Minister Nada shared, the life expectancy in India is around 71. The life expectancy in the US is 78. So suddenly you will recognize and you will realize for 10% of variance on life expectancy, you're getting a care for 100 times cheaper price. This is miracle. So last night I was thinking, maybe Prime Minister Modi, Minister Nada, and all the amazing people in this room can actually solve the US 31 trillion debt problem. Because if India runs the US healthcare, US will save about 4 trillion per year. In less than 8 years, US will have no debt. And I think that would be great for the country relationship with the US. Now, from my experience, it's almost impossible to make an expensive healthcare system low cost or decrease the cost. The cost always goes up because once the cost is committed, it's a very hard struggle to take it back. But I know we can make a low-cost healthcare greater, better. And there is a very simple path for that through technology. Good healthcare is nothing except having the right data, the right informations, following the right protocols, and more importantly, having supervisions and monitorings on the situations for each patient when they need that monitoring. And these are the stuff that technology is built for. And combining that with these new AI models that all of you are using and been using since probably 2-3 years now, this is almost a guaranteed and a done deal. That if someone has a low-cost healthcare, if a nation has a low-cost healthcare, even it might not be the most perfect today, it can become a perfect healthcare as well in a very near future. And this is where frugality can live and stand next to quality. But there is one problem. And the problem is most of the technology and softwares that are implemented in health systems within governments are not ready to adopt these new AI models. Because most of the softwares historically, from EMRs and data collections and everything, workflow management, they've been built to collect data, store data, and at best, give you some charts. For bringing diagnostic AI, predictive AI, intelligent decisions makings, you need to have new kind of softwares. The softwares that are regulated, the same way that drugs and devices in medical wards are regulated. There's new category of these kind of softwares called software as a medical device. And when you install those kind of technology, you can get the most out of the technology that is coming with AI. And this is where my company, Huma, and our technology, Huma Cloud Platform, comes to play. Because Huma is the first and still the only configurable software as a medical device technology that has FDA approval Class 2, EU MDR Class 2B, and we also have India CDSCO Class C, which allows a health system, a government, to come in and build the workflows, the applications, the softwares you need, the way that is good for you, rather than you fit yourself into the solid softwares that you're using and you bend around the software. You can actually bend the software around you and still stay safe, effective under regulations. And then brings all the kind of algorithms and predictions and decision supports into it. And that's why thousands of large health systems around the world, 15 of the top 20 pharma companies around the world, from Roche to AstraZeneca, to Pfizer, from governments of the world, from Germany to Greece, small and big, they're partnering with us to reshape and rebuild the future of what AI can bring to their world of healthcare. And when you have the data, which we have a lot of those, and more data are being produced every day, combined with AI, you can make care proactive, predictive, without needing to rely on humans as much, and allowing humans to do what humans are good at. But today's healthcare, mostly, almost everywhere in the world, is reactive. And that's what Minister Nada was commenting on. And this is why we are very excited to bring regulated technologies. And more importantly, make it so that you can build what you need to build for your country, for your health systems, for your pharma, for your product, 10 times faster, 10 times cheaper. And then embed technology so that the nurse can look after 10 times more patients or 100 times more patients. Embed technologies and bring AI so that lots of the works that doctors are doing today, a nurse can do. Maybe at some point a technician can do. Again, healthcare is about the right data, protocols, the right supervision. All these three things, technology can do it really well. And in most places better than human, because human can make an error. Technology never gets tired. Now, Huma is not the magical box that can solve every problem. We are not. But we are a box of tools that we can give to people, to entrepreneurs, to enterprises, to take on the challenges and solve them the way that works for them, one after the other one. And that's why all those partners, they have partnered with us. For a hospital, it would be installation of our technology on top of all their existing systems to make that hospitals AI first, digital first, enable that hospitals, if they want to build a care pathway for cancer, they can make it. If they want to build diagnostic programs, predictions programs into that, they can do it very quickly. For governments, they can have all the data about all their citizens and how the health of them are improving, what is the operational and utilization of each hospital's different drugs, and so on and so forth. And for citizens, you can do things that I think is considered impossible today. And it's happening today in some countries that we have implemented. Minister Nadal talked about early detection, screening. One of the beauty of what technologies like ours is doing, you can screen an entire nation for cardiovascular disease. In fact, I did a calculation. I can screen every Indian citizen for their cardiovascular disease and give them a very clear projection of what's going to happen to them 10 years from now, from their heart health, and what they should do to avoid that, or shouldn't do. And it will cost them less than 1 rupee, which is the cost of 1 minute to go to toilet in public hospitals here, public toilets here. So with less than 1 rupee, you can have a very clear visibility on what's going to happen for cardiovascular disease of entire nations per citizen. And that's just an example. Now, if the foundation is in place, suddenly Minister Nada talked about this technology for pregnant women and the tracking and the supervisions there. Imagine the same thing that is already implemented in some other countries being implemented in India, that every citizen, through an application on their phone, they can access all their medical records, book appointments, get their drugs, be screened digitally for most diseases, early detection, education, based on where you are in your life journey, all data about how well are you today, because health is not just when you're sick. Are you well? Is your sleep okay? Do you sleep well? Are you active enough? If you don't be active, what's going to happen to you when you get to age 70? All of those things you can deliver today through a technology like that for, again, less than a rupee per person. And imagine what would be the life expectancy of Indians. Let's say we do no other changes except getting everyone to be 10% more active and eat 10% more healthy. That will have profound impact on totality of the health of India. Now, all of these things are amazing, magical, impactful. But I think India is sitting on something even greater that I have not heard anyone talking about it. Once you implement the right infrastructure, the regulated software, implement those software, what is the outcome of that? Collection of clean data. India has the biggest populations in the world. That means a lot of clean data. That is a gold mine. Because that can turn India to an exporter of healthcare AI models to the world in ways that no nation can do. That brings income for the country, that enables funding of more technology, and then the more technology you implement, the more data you have, the better models you will have, and you get to this compounding positive cycle which benefits every Indian citizens, but also benefits the world, and it generates lots of income for Indians and India as a country. And I think that would be the third miracle of India for the world and also for its citizens. Once again, I'm extremely honored and grateful to be here, and I hope I get the chance, alongside all the legends, pioneers, entrepreneurs, industry, institutions, enterprises, we can contribute toward the mission that Gandhi has set for us, for all of us, no matter where you belong, no matter which country you are from, to ultimately do the right things to make everyone's healthier, more optimized version of themselves. And I think, and I actually believe, India can lead that for the whole world, as crazy as it might sound today. I'm very grateful for everything, and thank you, Varun.
Thank you so much, Mr. Verit, for that very inspiring, thoughtful words from you. Thank you once again.
Ladies and gentlemen, as we move forward to the concluding moment of this session, may I request Mr. Varun Khanna to kindly propose the vote of thanks.
Thank you. So, ladies and gentlemen, this won't be too long. This is the most difficult thing I've ever done. Thank people, because this is the only time nobody wants to listen. Everybody wants to get out. So I'll try and engage you. The only good thing about thanking people is there is a chance कि आपका नाम लिया जाएगा. So उस नाम की इंतजार करें और ध्यान से सुनें. First and foremost, I got to thank Shri J.P. Nadda today to grace the occasion. And as always, he puts things very simply, very beautifully. And you start feeling that India is making real progress. So to that, I think it was exceptional today. Our own Professor Paul. Big thanks to, and some of you really missed, two of the most amazing sessions that I've seen in my lifetime. That's Dan and Raji. Fantastic, fantastic sessions, I have to tell you. Where have you heard someone tell you that you can optimize yourself in a simplistic way by spending 1 rupee? You know, when I go out to optimize, the corporate consultants around in this room charge me millions of dollars, and still I don't get optimized. So next time you want to get optimized, please don't look at the people who've done those papers. Go to Dan, he'll do it in 1 rupee. Dan was amazing. It was amazing. One of the other things Dan said today, and very simplistically, but I have to say it again. He was able to solve for India-US issues, and he was able to bring down the debt of the United States in 8 years to 0. And guess what? When he did that, what happened? When he did that, he brought to India a $4 trillion opportunity per year. Have you ever seen a man simplifying life so much for India? Thank you once again, man. Raji, she was, she wanted to talk a lot. Actually, she started by telling me, don't look at me with those eyes, to say that cut it short. And she cut it short herself, because a lot what she wrote was, I think, addressing the minister. Raji, apologies about that, but I can tell you every word's been recorded. And every word about it was said, we've heard. The work that I think you guys are trying to do is exceptional. The work that the pharma world is doing, and I think I'll not only say Roche, but some of you are doing, is actually extending our lives. And that's not easy. That's what life is all about. If India has been able to get to 72 years of life expectancy, world's gone to 80, I think thank you all for doing it. Outside of that, I have to thank a lot of our own people. Listen, clapping is a very good exercise. Right? And for those of you who were at the awards yesterday, three gentlemen on the dais, you know what they did? They got up, they sat. I can make you do that if you like. Otherwise, clapping is the option. All right, so the first and foremost, Ficci Health Services Committee, Dr. Harsh Mahajan, he's not here, but let's give him a big round of applause. Our co-chair, Dr. Anupam Sibal, my dear friend. And I can tell you next time it'll be a debate between both of us who will do it, because none of us really want to do this again. Someone who characterizes life in a way that I look up to, Dr. Narottam Puri. Okay, till you clap, I can also not go forward. So if you want me to truncate it, continue clapping. I'll go faster now. The Swasth Bharat Task Force, Brigadier Dr. Arvind Lal, Dr. Arun Agarwal, and our mentor, Mr. C.K. Mishra. I got to acknowledge the organizing committee for Heal Awards and session conveners. The conveners were Dr. Harsh Mahajan, Brigadier Lal, Dr. Narottam Puri. Come on, continue. Dr. Sibal, Dr. Arun Agarwal, and Ms. Malti Jaiswal. Ms. Malti Sachdev. It'll only help you. Mr. Gautam Khanna and Kabir Mahajan. You know, I'm just thinking I can invite Dr. Puri here to tell you benefits of clapping, if that's the session that you want next. Doesn't matter if it's not on paper. The award organizing committee, Dr. YP Bhatia, he loves it. He does it in style. And I can tell you it's not easy what he does. For 17 years to keep the award sacrosanct, not get corrupted, there's one man who's accountable. Give it to him. Dr. Ravi Gaur, thank you so much. Also, this is the first time I've done a knowledge paper, and I'll never do it again. You think it's serious? You've seen the amount of work. Itna kam main apni company mein karunga, I'll be a billionaire man. Right? So kudos to the 3 knowledge partners. It's not easy. I just realized. Kaivan, Akshay, Ankur, you've been incredible. It's not easy to put a book together. And sometimes I wonder, do you all read it? Right? But if you don't, I can tell you, this time I've worked on it. It is so incredible that one book tells you everything about healthcare. You'll never need to go to any other document ever again. So please do have a look at that. Mr. Sainath Sunil, who's the Account Director for Public Policy at Chase Advisors, I haven't seen your work, but I assure you after what I've done, I'll read it. Mr. Lalit Mistry and Shri, thank you so much. Okay, finally, this one's big. This one's really big because if you don't clap for these people, there's no field next year. They are our sponsors. And right on top, it's quality care, which is, it's been a privilege, and thank you, everybody. Rosh, thank you so much. Thank you so much for supporting the endeavor. Our perpetual supporters, I don't think of the 17 years, there's a year that he's not supported. Dr. Lal Path Labs, Siemens Healthineers, our friends at Apollo Hospitals, Abbott, Gotham, PD Hinduja. Not only does he bring in funds, he brings himself, which is an added advantage. Our technology partners have been Wipro GE Healthcare, session sponsors BD, Alzheimer's, SS Innovations, and Fortis Healthcare. Innovation partner, Intuitive and Philips. It was a brilliant session this morning for those of you who didn't see it. Electa, badge sponsor, Aster. For those of you who don't know, Quality Care and Aster is proposed to merge. So we are pending some legal stuff, but that's where we are. Our strategic partner, Ernst & Young. Knowledge partners, BDO, Chase Advisors, KPMG. Corporate sponsors, Amrita, Aurum, Marengo Asia, Onquest, Yashoda Hospitals. Yeah, I like that. You'll feel better about yourself, don't worry. And now the most important people. You know who the most important people for this session are? To all of you lovely audiences. Come on. Yeah, इसमें तो दिल से बजा, इसमें तो मैं भी बजा. You have no idea. You have no idea. It's easier to get a speaker, difficult to get an audience. And what I've learned this time is I'll still be able to manage speakers for next time, but I have to be very particular about who the audience is and where do I get them from. And how do I get the audience which has the attention span to be here all the time? And that's what you are. Come on, once again for all of you. Sorry? Anjanda, you have been clapping. By the way, Anjanda is voted as the best audience. So there are 2 people in this room who have made it a point to attend every single session, heard thoroughly. One is Dr. Vishnu Panigrahi. And all right, it's just about 30 seconds more, but these are important people in my life because I deal with them quite regularly. Leena, Shilpa, Sarita, Ayushi, you guys are exceptional. Thank you so very much. If ever I did this again, I won't do it for the audience, I won't do it for the speakers. I'll do it only for you all. Thank you so very much. With that, I conclude my thank you speech. Thank you.
One of the most Yeah, thank you so much. Well, the most incredible word of thanks I have ever heard, keeping everyone so mesmerized, so energized, and motivated. Thank you once again. Ladies and gentlemen, with that, we conclude this session. And I would request you to kindly be with us as we straight away move to our next session, which is the panel discussion on therapeutics through technology. We will take exactly a moment to set up our head table, and we request you to kindly not leave the hall, kindly remain seated for us to begin with our next session in no moments from now. We've been indicated that our honorable speakers for the next sessions have already arrived, and we wish to begin in no time. Thank you so much for being with us. Kindly remain seated. Incredible. So you speak so well. Yeah. Truly, so mesmerizing. Once again, may I request everyone to kindly settle down. We wish to begin with our panel discussion. May I request everyone to kindly remain seated, please? Welcome back, ladies and gentlemen. We now move to our session, our panel discussion 2 on therapeutics through technology. Ladies and gentlemen, breakthrough in science and technology are fundamentally refining how we understand, approach, and deliver treatment. This session will bring together the leading experts. We already have them on stage to discuss how emerging tools and platforms are transforming therapeutics from molecular level to patient-centered care models. Without any further ado, we now introduce our experts on the dais. We are very honored to have with us the convener and the moderator of the session, Mr. Gautam Khanna, past chair Ficci Heal Service Committee and CEO, PD Hinduja Hospital and MRC. Warm welcome to you, sir. We're also honored to have with us Mr. Shankar Sheshadri, Vice President India, Subcontinent Lelakta. Warm welcome to you. And we have been joined by Mr. Chandrasekhar Sibbal, who is the CEO India SS Innovations. On the dais, we also have founder, DRG Path Labs, and Chairman, Medical Advisory Committee on Quest Lab Limited, Dr. Ravi Gaur. And we also welcome Business Director, Integrated Diagnostic System, India, South Asia, BD, Mr. Puneet Talwar. We also welcome CEO and co-founder, THP Group, Mr. Akansh Khurana. And now, may I request the convener and the moderator of the session, Mr. Gautam Khanna, to kindly take over.
So, good afternoon, everyone. And after a wonderful session in the morning and the incredible vote of... Can you hear me now? Okay. So I was saying after a wonderful session in the morning, and I'm hoping the topic of our session today is therapeutics through technology. So I'm hoping that even though I don't see too much of an audience here, technology is enabling this session to be transmitted there and somebody is watching somewhere. So with that, just to take a minute of yours to set the context, and we have eminent people on the dais here, and they will talk about their views and what they are doing and where the world is taking us. What we've heard in the last 1.5 days is the way healthcare is transforming, and we've heard all the metrics, we've seen all the things happening in the infrastructure, technology helping in access, technology helping in all the patient experience, etc., etc. But what we are going to talk about today is the most key part, in my view, of where technology is going to help, which is in the therapeutics. How does it help in actually treatment of the patient? So what we are talking about, technology outside. Now we are talking about technology which is going to really impact the patient outcome, the clinical outcomes, and how it is going to be adopted. So with that context, I am going to ask my eminent speakers, and all of you please, not in any order, I'll ask some randomly, so it might go here and there. So we've not had a chance to talk as a group, but so let me start with you, Shankar, sitting next to me. So now, Shankar is the Vice President of Indian Subcontinent for Electa, so all of you know that. So you've been very active, your company has been very active with high technology equipments. And can you tell us something about how are the technologies like in ART, LINAC, PET, etc., in oncology care, how is that helping the therapeutics part? That is one part. And second thing is, we heard about AI in the morning. So is there a role of AI which you are using to give for helping therapeutics? So if you can give your views.
Thank you, Mr. Gautam. First of all, thank you, Ficci, for having me here. It's an honor and privilege to share my views on this particular aspect of questions. First is, if you look at the oncology industry today, in India, we still have radiation therapy is only available to about, or is being used only by about 29 to 30% of the people in India. Whereas worldwide, the average is in excess of 50%. So there is a technology which is available for better cure, or at least alleviating the pain. Still a far growth available for that for us India to grow. Even when you now come into this 30% of people using radiation therapy, lot of hospitals still only conventionally treat the IMRT, IGRT kind of treatments, or the palliative care 3D CRT kinds of treatments. We still do not see an adoption of SBRT as a technology for treating cancer care. It's still only about 25% of the population who have cancer care actually get treated SBRT. Now, this again is another significant scope for improvement in cancer care. Having said this, there are other many new technologies which are already coming up, like adaptive radiation therapy. That's the new paradigm in cancer care, the adaptive radiotherapy, which you have both the conventional CT LINACs or the new invention which has come, the MR LINAC, which helps in this adaptive kind of treatment. Now, what this does basically, it is moving towards, like a lot of people talked about in the various sessions, more personalized medicine, more customized medicine, and more effective medicine. So in your body, when the tumor is being detected, as the course of treatment happens, the tumor keeps moving. It either changes in shape or it changes in position. So the conventional way of treating them means the dose delivery is still not adequate enough. So you actually need to track the actual tumor and then treat it. So for this, you need a technology, which is the new adaptive technology, which is being more and more being available worldwide, and it's already begun to come into India. We already have many centers in India who have adopted the early adopters of adaptive radiation therapy, and there are very few players who have the MR-Linac radiation therapy. This helps significantly in improving patient outcomes, reducing toxicity, much higher large localized tumor control. You saw today in the morning AI session, people talking about how it helps. So AI is actually playing a significant role in every aspect of the radiation therapy, whether it is from the treatment planning system, which is there. We heard one of our colleagues from Siemens talking about it. Today, the AI helps in automatic contouring of the patient tumor. For a head and neck cancer, today, a conventional hospital actual treatment planning time, the contouring time takes close to about 30 to 35 minutes. This comes down to 2 minutes in an AI-driven automatic contouring system. So that's a significant drop. It's just not head and neck, whether you take liver, you take pelvis, you take pancreas, all these various organs, the amount of time being spent on the contouring significantly reduces, not by 5%, 10%, almost 30 times, 40 times. So that is a lot of amount of time the doctors have for being with the patients than with sitting with the machine. Machine helps them. Of course, you still need to do the fine tuning of that, which is a significant part still. However, this helps significantly. The second area where the AI helps, of course, in treatment itself is from the imaging point. So whether it's the MRI, the CT, the PET, which is all evolving, the image quality of the system is improving by the day, which actually helps in this adaptive treatment. All these various AI models actually help in ensuring that the visualization of soft tissue is so much that hitherto unheard of cancers which are not being treated effectively, whether it's a pancreatic cancer or oligomets, they are actually getting now treated much better, which means the outpatient treatments are getting better. And the longevity of the patient due to these kinds of treatment are actually increasing from almost 20 to 30% to almost 60 to 70% in various kinds of cancer. So that's how the AI is actually helping.
Shankar, thank you. Thank you, Shankar. Wonderful to hear that. So before I move to the others, Chandrasekhar, may I ask you a few questions? So you have the unique advantage, or let's say unique identity of developing a robot in India. So can you tell us, how does whatever invention you have, the robot, how is it helping? And we saw one example of telesurgery being done from one city to the other a few months ago. How is that helping, and how will it help the country going forward? And what are you seeing as a benefit to the patient? Because as of now, what I am seeing is that even if you are doing from city A to city B, both the cities need to have the robot, and both the cities need to have a trained kind of a surgeon. So then what is the advantage? What is your view? How will it help the country?
Okay. Thank you, Mr. Gautam. And thank you, Ficci, for calling us here. And I would like to tell you that Dr. Sudhir Srivastav, he worked in US for 40 years, and he came to India, and when he has seen the cost of robotic surgery was very high. So he was not able to perform the cardiac surgery for one patient. So he said that why should I not develop this robot for India and third world countries, because this technology was only limited to US and European and very high income countries. So he himself put all his money, he sold his hospital, he sold his house, he sold his car, everything. And some divine power came with him, and a lot of engineers. He first went to Germany, then he went to China but could not make, and finally came to India. And with 15 engineers, team of those rock band, he calls them a rock band, those people have developed. He has come out with the 1.0, then 2.0, Mantra 2.0, and Mantra 3.0, which has now much improved model. And we are going to take a CE and FDA approvals. Once that has happened, it will be a big thing. And now we have 125 installations. The first thing is the accessibility, democratizing of the healthcare, because he wanted the same level of care which is given in US should be given to our patients. Because the surgery is very precise, it requires very less cutting, less pain, nerve sparing. It can be a huge, huge differential in the life of the patient. When anybody wants to go for a surgery, if I will go for a surgery, I will say definitely I'll go for a robotic surgery. So it is not a question that we want to go for a open surgery or a lap surgery. We will definitely like to go for a robotic surgery. It is much more precise and less time in the hospital. So many, many benefits are there. Apart from that, actually our cost of the equipment, it is half of the top company, and also 1/3 because the instrument cost, which is the running cost, is 1/3. And the major point is that we are able to do the cardiac, all kind of cardiac procedures, because Dr. Sudhir Srivastava himself is a cardiac surgeon, and he still devotes almost 16 to 18 hours every day in the office talking with the R&D engineers. ये वाला इंस्ट्रूमेंट इस तरीके से बनाओ, इसका फ्रीडम इतना एंगल होना चाहिए, इसमें ये होना चाहिए, ऐसे कटिंग होनी चाहिए. He still works very hard. He does surgery himself, and telesurgery, I tell you, is a very important thing. Actually, there are two aspects to it. One is the proctoring, teleproctoring. That Dr. Sudhir or these kind of surgeons who have done 1400 robotic surgeries or can proctor anyone who has not done that many things, because the planning is very, very important. So he can proctor sitting in his office or in his home to the other surgeons while they are doing a surgery. So that's a very, very important point. And second is that in case there is some problem, or because surgeons hand to hand is different, but definitely robot will give more freedom for that. But definitely some surgeons are gifted actually, and they do surgery much better than the others. I've seen the hand and eye coordination of many people. So those expert people can do that particular procedure for some time, take the suturing or those kind of things, because very, very small sutures are there. So those kind of things, if they are proficient, they can take and then give it back to them wherever they feel that they're facing an issue. So this is going to help. And I give you example of Moradabad. There is a small place in UP, and Dr. Magan Mehrotra and Dr. Leena Mehrotra, he's a general surgeon and his wife is a gynecologist, 30-bedded hospital. They are doing around 100 robotic surgery every month. And so there was a VVF case, this thing. So Dr. Vaddi actually from Hyderabad, he is a neurosurgeon. He has done the case by sitting in Hyderabad. Otherwise, he had to travel to Moradabad. And with the same efficacy, though definitely here also the surgeon was there, but he was a general surgeon. But the neurosurgeon was sitting in Hyderabad. Dr. Vaddi, he has done the case, and very successful case. And similarly, many other places. Now, because we have 125 installations in India, so we are looking at a very fast going to the very small villages, small places now this is going to go, where the 30-bedded, even 10-bedded hospitals are now taking, where husband-wife doctors are there in those kind of clinics, and they will take a support for any kind of a surgeon. So this will be a huge, huge differential, sir.
Thank you, Chancellor. This is very inspiring what you mentioned to me. So switching gears a little bit, Dr. Gaur. So you've been in this field for decades, and you know the field of pathology very, very well. So can you talk about how digital pathology is transforming the field, and how can it be linked to the regenerative medicine and longevity which we've been talking about? Is there some connection?
Thank you, Gautam, and I think my pleasure to be here at this forum and discuss amongst experts something which I've learned from all of you and probably coming back to you. So I think digital pathology we're talking about is transform the diagnosis. It's not like an image. It's like, transforming diagnosis from isolated act of reporting to integrated and intelligent continuum care. That's the most important part. It's no more like you're just diagnosis a disease, and after that, what happens? So today, if you talk something, I think probably I'll go back to say that the radiology, pathology, and they're getting definitely integrated, because that's what we say is 5M. One is, of course, the macro. Macro means the radiology. Micro, the microscopic. Then you come to the molecular, that is M. And then all this integrated can deliver, help you in a personalized medicine, medical therapy. That is a medicine. And then ultimately is a miracle. That's what we talk about. then this can lead to, predictive, preventive, prognostic, and of course, personalized therapy. That's what digital pathology. Now, coming specific to the digital pathology, that's the surgical pathology, an example I'll give you. When we do a histopathology biopsy slice in a glass slide, it's a static image. The static image is now actually taken up and it can be transferred across anywhere. That image, based on that image, what kind of image is, what nucleus is, what the cell size is, what's the necrosis, what is the percentage, you can actually come out with the diagnosis. So today it's, because there's multiple, so many organs, so many tissues, we require a lot of validation on it. But yes, today it's been utilized for prostate cancer screening. It's been used for, metastatic in lymph nodes. We can identify kind of a thing. So I'll give you a small, data, what something which is, I'll say, what's happening is this, and this basically the, it's helping us out in therapy. First and foremost, at pathology workflows. See, there has been something like, the software for Nature Medicine has done, which is like, they trained about 2.5 million images for brain tumor. And based on the brain tumor, and they said okay, they will do a screening. When an individual pathologist does a screening, it takes about 20 minutes to come out, okay, this is what looks like a malignancy, and then they further. But when it had AI-driven model, it was almost 150 seconds. They were able to come out, so reduce that 20 minutes and focus it somewhere else. Similar thing is done for, you can say for breast cancer. Breast cancer, very important is ER, PR, and HER2. They're three important markers. Now, HER2 is generally, this is by two technologies, immunohistochemistry or done by, you can say, immunofluorescence. Now, there is always a doubt, and therapy is all defined on that combination of all the three, positive, negative, and a percentage expression. In HER2, it's generally, you'll find about 20% cases, it comes about, because of the ultra low expression, it becomes like negative or EQ vocal. Now, what do? You're done in histopathology, doing an IIC, and after that it goes to immunofluorescence. That takes another 6 days, 7 days. So probably the whole thing is delayed by about 10 days. But by AI, there's a data, there have been a lot of studies, and there are a lot of now AI-based software which are available, which can say that increase the HER2 sensitivity, run through the screening from 49.3% to almost 74%. That means that much number is improved. So your diagnosis right on the day 3 instead of coming on day 1. That's one. Lastly, the triage. I think what is important, like pap smears. Like if you look at the pap smear screening cancer cytology, we have a cytoscreener, a deep cyto AI model which is existing, where the AI does what? They say that the AI, because as a pathologist, you're supposed to look in the microscope and see the cells morphology. It takes me about 10 minutes at least to screen and then kind of work out. And then after that, probably you work further on it. But using a PapNet or such software, we can actually they do about 1 to 2 minutes. The whole slide is scanned and they come out, this is where it is. So, and it improves your, the data again, this survey which has been done, which also say that they have almost like 11% increase in sensitivity and specificity of the reporting. That's very, thing. And of course, now come to molecular and genomics. Of course, everybody knows. Today we have therapies which are defined on the genetic mutations. Whatever the mutations that happen. Today it is very personalized. Any cancer is, no two cancers are alike. Every cancer behaves differently. So in cancer, you do a molecular study, you do a whole genome sequencing or a limited sequencing, whatever, you come out with the DNA mutation. And based on mutation, there's a therapy. There's a drug which acts on that particular mutation. That's why the chemotherapies become so safe. It's like a daycare, no more fatalities happening. And so precise. I think making precise, and off late, just sometime back, we just heard something has come out with a bandage, which is a self-monitoring bandage. Because what happens in healing, it's helping. In that, you put a bandage. That bandage monitors the oxygen saturation, humidity, the moisture, and the bacterial count. And from the remote, you can monitor, and you can come out, because this is what it is. And then based on that count and humidity, and you can modulate from distance, and microscopes this is the impact with the antibiotics. It can be released out there. And then you can, surgeon sitting between diabetic foot or remote areas, you can monitor that. And lastly, very important is, I think, this is not an air today, like frozen section I'm talking about, which is already now there in the part. The PET scanners are, of course, taken over more of a frozen section. Very few people are doing frozen, but it is not required. But still, frozen section is a need. Now, in frozen section, they have or something called a smart knife. What happens in frozen section is you go for a surgery, you do a specimen is sent to the lab. It takes about 20-25 minutes. You come back with a report, positive. Margins are clear or not, margins are not clear. And once you go back, 25-minute patients under anesthesia and open, exposed to all kind of exposure. Smart knife is impregnated with this kind of a thing, and where you can actually, the moment you cut the margin, you say, this is still got a margin is not clear. Go further. So right on the spot, within a minute, you know, I think this is margin. So that smart knives are already been validated to be used in Germany, and they are now into practice. So the integration, the molecular imaging, all this together, I think taking to the next step, I think that's a great thing which is happening. And I'm very sure it's already happening. It's already arrived. Only thing is we need to probably be careful and cautious about it. How to validate it, how to integrate it, how to understand it, and never think like going to replace you. You just got to augment it, your intelligence and productivity. That's what digital pathology is.
Incredible, Dr. Gaur. So some of the things I did not know. I mean, I did not know about this self-healing bandage. I did not know about the smart knife. And I think people who are running the hospitals will be looking for the smart knife, because this problem is in most hospitals, frozen section issues. But coming back to other panelists, Akansh, I'm going to come to you. So you have a special company which you will talk about it, which is into large data analytics, and you do lots of other things. But I want to know, how is what you do, how does that help in management, and how does it transform the therapeutics and management of chronic care diseases? What is the insight you get? How do you apply it? And how does it help the patients in the country? Akansh.
No, thank you, Gautam, for having me here. Thanks, Vicky. We've been hearing multiple panels and panelists, fellow panelists. We speak about advancements in digital pathology, advancements in cancer care, precision medicine, advancements in robotics. One of the byproducts of all of these advancements is actually generation of data. And how do we use that data to apply it back for further advancements is basically where role of a big data technology and big data analytics company starts. So thank you for the advancements so that that data can be produced for continued advancement and R&D over a period of time. Now, specifically, Gautam, to your question on chronic care. Chronic care is indeed one of the largest burden on any health spends. And, not just in India, we spoke about US, the top 5 or 6 chronic diseases almost take away 60 to 70% of the healthcare spends of any nation. One of the ways in which the big data gets used is combining it with technology that can support the care. So the big data model in general would help predict early diagnosis, would predict a possible comorbidity, would predict a possible ER incident that could happen, and combined with the technology would provide the tools to a nurse coordinator, to a doctor, to a contact center agent, all the various folks who take care of a patient in that hospital ecosystem to manage that patient better. Now, the interesting thing about advancement is, historically we used to speak about using data to publish evidence so that people can learn from it. Then we moved on and we said, okay, we can actually use the data to predict the disease as well. Then we moved on to say, now that we've predicted, we can actually tell people how to preempt it and prevent it. And with the latest advancements of LLMs, the interesting bit is now a bunch of that can be done by an agent itself, an AI agent itself. So, the time to provide the care and the time to manage the change of how an ecosystem works is changing so quickly that from the time the data is prepared to predicting it and an agentic AI to provide the right information to the patient and help him through the care is just fundamentally changing the reduced time of care provided and therefore improvement in outcomes. We are constantly seeing that 10% reduction in care gaps is purely just by telling people and making them aware. Another 10 to 20% is by educating them through nurturing. And then another 10 to 20% is through hand holding, by making sure that the care coordinators, etc., are providing the care. At least half the gaps in care can be prevented by some simple technologies powered by big data in the background, and reduce that cost of spend by at least half.
Thank you, Akansh. I'm not going to let you go. I'm going to ask you one more question. It's a little question on, you started the company after leaving one of the big fours. So it's a tough thing to do. So what are the barriers you have for people, for you as a technology company for adoption in the healthcare community in the country? So, because you are saying it is helping the patients, but the adoption is difficult. So what are the barriers? What do you want to say?
I think the answer to that 5 years ago was different than the answer to what it is today, and different from what it used to be pre-COVID. So the reality is, we all evolve. The industry evolves, the adoption evolves as well. At one point, access of data was an issue. Half the time, the data was not available. Thankfully, most of the leading hospitals, and many of you are sitting here in this room as well, now actually make an effort to compile digital data. So, some of those barriers are now gone. Then the second set of barriers kickstart saying, now that the data is available, the believability of whether this will actually lead to certain outcomes. Eventually, we all want to provide the best care, but eventually, whether it's an investor backing a technology, or it's a corporate taking a leap in a technology, eventually it got to run sustainably. And the end outcomes and the results generated from that is going to define how the technology will get adopted. So that early believability becomes a barrier, which I think over a period of time also, now that many of you have taken the leap in adopting these technologies, is making a difference. Now I think a lot of the work goes behind change management. One of the biggest pieces, the reality is that there's still shortage of talent, and the talent that is available, it takes a lot to make sure that talent actually works the way the technology can be used in the best possible way. So driving that change management of people also is another barrier that over a period of time mitigates the scalability. And then, some of the newer sort of technology, and I spoke about agentic AI exactly for that reason. One of the big pieces of work that we are seeing is, because there's shortage of talent and because change management is an issue, can the voice AI agents do the work that we need humans for? Not necessarily taking away jobs, but the reality is we still are the biggest diabetes capital of the world. We still have, highest cancer incidence. We still only reach 30% of the patients for radiation. The reality is there's still so much to do. Can you cover that gap by making sure that the talent gap as well as the change management gap can be mitigated? So I think a lot of now is less about data availability or believability. It's now about how do you do it at scale, and how do you do it at scale very quickly.
Thank you, Akansh. Very helpful. Coming to you, Puneet. So Puneet, you are running the integrated diagnostic systems. So I want to know, how is your area helping in accelerating the discovery, in medical discovery, and any examples we can share that you have helped in terms of therapeutics? How is the technology? How is the diagnostics? How is it helping? So.
Thank you, Gautam. Good afternoon to all the distinguished audience. So integrated diagnostic solutions or systems that we talk about basically is combining data, patient-related data from all possible sources, which can be imaging, pathology, which can be clinical data, genomics, molecular data, and then putting that through the algorithms that we have from the AI and the machine learning, and coming out with really specific personalized data points which can be given to a physician to actually give the personalized treatment on those. So we have seen a lot of progress especially on integrated diagnostic solutions, how it has helped in terms of patient management and improving patient care. Biggest example is, I think, is oncology in the companion diagnostics, where basically by studying the genetic mutation of a particular patient or that tumor, you can actually give personalized treatment. And you can actually cure the cancer to that level. Also, a lot of success that we have seen in the breast cancer treatment, which was also alluded by Dr. Gaur, based on the integrated diagnostic data that we get. It is also helping in actually enhancing the biomarker discovery. When you are asking how this integrate, so by getting the data points of multi-omics data, that's from proteomics, genomics, and the spatial data, you are actually able to develop new biomarkers which will give you early indication of any disease progression. Also, which will give you tools to identify at-risk individuals who will develop into, say, a cardiac problem or oncology problem later on. Also, this integrated diagnostics data also helps us in forecasting disease progression, and that's something which is becoming very critical and important in today's world. So I think a lot of advantages that you can get from integrated diagnostic solutions available, a lot of tools, especially coupled up with the AI and machine learning software that is helping today's healthcare and the discovery in a better way.
Thank you, Puneet. I'm going to continue with you and ask you one more question, if you don't mind. So, since you are part of a large medical device company, so can you suggest what do you need from many of the healthcare providers here? What is it that you need to help us deliver better therapeutics by using technology, by using medical devices to help the patients? Anything you need from us? From the healthcare provider. I mean, there are many of them.
Sure. I think a seamless integration of a patient data in terms of access to that patient data or his clinical history is something which will be very beneficial for any company looking to do major breakthroughs in terms of treatment, in terms of drug development, in terms of how to manage the patient care even in the later stages. I think that's something as a healthcare providers from this distinguished audience or in this industry congregation, I will say, if we can all align ourselves to have this patient database available across all of us to develop better treatment tools, to develop better drugs. So I think that's something which is will be the need of the hour.
Thank you, Puneet. Dr. Gaur, may I ask you one more question? So you talked about different examples and I was really impressed with what you told me. But you know, there is a shortage of pathologists in the country and it's a very key skill required in the country. So how the technology can help us overcome that shortage?
Well, I think digital pathology, in fact, actually started with this because that's something what we started with histopathology and biopsy. The images can be, I'm sure Lal is sitting here, he's utilizing that facility still. I think a lot of bigger labs have now started. Image from here, because my histopathologist say in a hospital like yours, probably I'm sure 150 or probably that much kind of issues are being reported every day. But then you have to deploy 20, like 10 pathologists to report histopathology. And then there is always a second opinion because sometimes you require a second opinion, a third opinion, subspecialty opinion. How do you do this? Here we have images. Now images can actually, like say for triage, you got 150 biopsies. I'm sure any good normal hospital, bigger hospital, only about 30%, 20% of malignancy, rest are normal, like gallbladder, appendix, and all kind of a thing. So let's run through the images to the scanner, the whole slide scanner. Okay, these are all normal ones. These are abnormal. Triage happened. Abnormal one put up fast, and you can have immediate kind of reporting. That's one. Then there is always a second opinion. Otherwise, and you can, because you have a chain of centers, you have multiple pathologies. Somewhere, you can optimization we were talking about earlier. So we can send the image, okay, to X pathologist here, Y there, and somebody is a super specialty there. Even I am using it something, we send images to place like UK for some people out there. You can send the image right there, and somewhere in India, within the chain, you can utilize it. Somewhere you have 20 biopsies, somewhere 40, somewhere. There are pathologists who can do histopathology, but there is no tissue processing happening there. So send the images there, let them report from there. You can utilize that optimization of manpower. That's a very important for digital pathology. Once you can do that, and then of course standardize the protocols kind of a thing. You don't have to, because what happens is the slide you report about 30, 45 minutes. Protocol, the structure reporting formatting. It could be structured 1, 2, 3, 4, 5, 6, automated. System say this is what you missed. Otherwise you come back and it's again and again it happens. So a lot of efforts goes into this. So that's a digital pathology which is definitely taking a very, very important role. And that's where you can take care. But the only thing is the training. In fact, COVID changed everything. Before COVID, we have a senior, I think, especially in histopathology, the biopsies, or they say like eyes are to be trained. But of course, now I think they were never willing to go beyond microscope. But now they are willing to. I think what I feel is that the digital pathology and the training should be part of your medical college training. Right from there, when you're doing an MD, put that. Automatically, you will use what you require to be done. Rest, let it happen. Screening can happen. Basic triage can happen. Identification can happen. Second opinion can be sent anywhere here and there. And they can be faster kind of a thing. That's what I think that's the best way to work. And I'll, of course, integrate your AI module. Because that's something where we've gone wrong. Otherwise, you do a corrective action, you keep following it and end up. But I just word of caution here for AI, what you mentioned here today. Because today, the another time spent on is on a communication with your clinicians. The pathologists spend almost like 2 hours probably talking, if you're good pathologists, talking to clinician, explaining them this. Everything is integrated together. You can actually become, instead of pathologist, you become a clinical solution provider. Integrate that. Diagnostics should be more of that. We're talking about to become a clinical team. And this system can definitely help. And it can reduce the queries and workload and processes. And the time can be utilized for better purpose. And lastly, I think I always say that when you're talking about AI is nothing but today we talk about artificial intelligence, but actually as the actual intelligence, that's also right. The actual intelligence actually should be used in a cautious manner. To use AI, definitely. With an actual intelligence, use your artificial intelligence. Depending on that, you can make it awesome intelligence or awful intelligence. That's what we should be talking about.
Very interesting, Dr. Kaur, very interesting. So, Chandrasekhar, may I going to come to you? Yeah. So, you talked about 125 installations in the country. So, there are many innovations like this happening in the country. What is your suggestion on how we can increase the adoption in the country to help the patients of the country?
So we are not only in India, we have exporting it to 7 countries also. And we have employed almost 500 people here. And we have a plan that we will employ 10,000 people and make 1,000 robots every year. That's our plan. So democratizing, getting the access of this surgical procedure to everyone. So for that, the training is the most important point, which we certify our surgeons to sit and work on that. And we have seen that the surgeons who are doing the lab collie easily adapt to this technology. And there is a Da Vinci, many people were using, because Da Vinci was the first company which has come into this field. And they were the only company for 20 years, they had a patent on this technology and nobody else was there. It was a monopoly kind of a thing. But now with our coming into this picture and development of our robo, now this is going to the masses and democratizing of the robotic surgery is happening. And we are opening the teaching, a lot of teaching academy with some hospitals. We are tying up with many hospitals now for opening those. So that is going to be a very, very important point here. And definitely our technology, we have some advantages over Da Vinci also, like cardiac surgery, like totally endoscopic CABG procedure can be done with us, not done by any other company. Because of Dr. Sudhir Srivastav's himself, he has done this kind of innovation. So he's a cardiac surgeon. So there are many things which we can do better. Definitely there will be something better in there also, because they are more than 20 years old technology. And we are actually improving our technology day by day by adapting a lot of digital technologies, AI, those kind of things are also putting into this system. And I would like and invite every one of you to visit our factory at Gurgaon at Sector 20 in Udyog Vihar. And it's a kind of a quality work which we are doing here is unheard of. There's some divine power which is running this thing. And the kind of, definitely it is with the Dr. Sudhir's this thing. And you must have to come and see. And I would request everyone, all of you have basically duty to promote Indian product. In Japan, the Japanese people do it for they will pay higher price for their product. But in India में क्या होता है, वो तो यूरोपियन खरीद रहा हूँ, मैं तो अमेरिकन खरीद रहा हूँ, वो मैं महंगी खरीद लूँगा, लेकिन ये इंडिया की है तो मेरे को सस्ती दो. तो ये चीज़ नहीं होनी चाहिए. आप लोग नहीं सपोर्ट करेंगे तो ये 500 से हमारे 10,000 एम्प्लॉय नहीं आएंगे. फिर हमारे बच्चे फिर यूएस जाएंगे, फिर ट्रम्प के पास जाएंगे कि $1 लाख दो, फिर ये होगा. वो चीज करना पड़ेगा.
ये डिस्कशन बाद
नहीं, मैं बता रहा हूँ सपोर्ट चाहिए आपको. तो that's what I'm saying, that we'll have to do that and believe in our technology.
Yeah, thank you.
Thank you, sir.
So, going to come to Shankar. Shankar, you talked about the wonderful technology. You talked about the MR Linac. You talked about the adaptive radiotherapy. What we are seeing, and many of us know this, that these technologies come at an enormous cost, which are not easily available to the many healthcare providers in the country. So what is the cost value equation you have in terms of how patients can benefit? Because if you have a technology and patients cannot use it, there's no point. So
a very fair ask. So today, if you talk of this technology of adaptive or MR Linac, if you look back, for a simple prostate cancer, a patient has to go to a hospital for almost 30 times, 35 times. And not only he goes, along with it, if he is coming from a faraway town, someone in his family has to accompany. He's got his work stopped for about 2 months, 3 months time. So there's a lot of other amount of money that he incurs over and above his treatment. It's just not the hospital treatment. It's for his stay, food, the paraphernalia involved. Now this adaptive technology, what it does is it brings down the number of fractions or the number of times the visit he has to go, say from 30 to 5. So which means within 1 week he gets treated and he goes back home. Now that is lot of advantage to the patient also, which means today as the awareness starts becoming better and better, more people will start adopting this. Having said this, still price is a barrier. There's no doubt about it. There are some newer technologies which are coming up, which probably will have better effects. I just want to touch base few things before I come back to your base thing. We are talking of immunotherapy, we are talking of nanoparticle therapy, we are talking of functional imaging. All these are today very limited use in the market. But if the awareness on this kind of treatments increases, probably more volumes will start coming to the hospitals, which will make them start bringing down the prices of the treatments. This is one. Second, even from the government reimbursement today, it is very generically documented. IGRT treatment, IMRT treatment, and a very minuscule amount is paid. But if there are specialized treatments for which differentiated values are provided, probably more hospitals will embrace. I'm not saying every hospital is looking only for money, but there are a lot of hospitals which are looking at ROI as the thing, and they depend largely on volume. So government reimbursements in Ayushman schemes, whatever they talk of, become a very important aspect for the reimbursement. In that, if a differentiated offering is given to the various kinds of treatments available with better outcomes, obviously you will start seeing some volumes picking up there. But having said this, our per capita income is only about $2,500 today. Compared to the world, we are significantly below. The patient's paying capacity and thereby the hospital's ROI earning capacity is so low that these specialized treatments will take some more time before it will become more prevalent in the country. I don't expect overnight things will change given the kind of costs they are. But yes, the adoption rates will start improving, which will, the word of mouth and the treatment outcomes will start increasing the longevity of the patient, which will in turn drive more number of people to come. I heard from one of the hospitals that all the doctors in that particular hospital are recommending their relatives, friends, etc. to go towards MR Linac treatment simply because it saves a lot of time, effort, and outcomes are better. So that's the voice of the community has to spread in order to get this adoption. But clearly price will take another probably a decade to come down on this kind of high-end treatments, for sure.
Shankar, we don't have a decade. We need it faster. Can you reduce prices faster? but I'm going to come, last question to you, Akansh. So we heard all this. We heard that technology is being used. We've heard many examples here. And the reason I'm asking you this is that you started this in India. Can you tell us what will it take for you to become global and do this therapeutics through technology to somebody in the Western world sitting from India? So any thoughts on that?
No, thanks for asking that. I think questions like these have a mixed feeling. You want to do as much for India. You've built the technology for India, but at the same time, you also want that you can sell this elsewhere globally, so that there's income coming back to India. So I think the good thing about healthcare is, and how healthcare of India is viewed globally, is technologies and services like revenue cycle management, uh, care globally, remotely, is already being done extensively from India for the world. Historically, the technology companies arriving from India and selling globally are relatively unheard of. However, as a people proposition, India has always been ahead in the curve. In fact, US revenue cycle management runs on India for practical purposes. Technology globally, the good thing about technology globally is, in healthcare, is diabetes in India is diabetes in the US. We all follow the same protocols. Doctors in India follow the same NCCN guidelines. We all follow the same ADA, AHA protocols. Clinical disease in India is clinical disease elsewhere. I think that, and the fact that AI is taking an active leap, it means that incumbent players who've been large software companies are also getting disrupted. I think this is probably the most opportune time for anyone in the world, not just a technology company sitting in India. Most opportune time for anyone to scale globally in healthcare technology, because one, the baseline foundation of clinical diseases is common across everywhere in the world. And with AI disrupting the incumbents, everyone has a fair opportunity to compete and play with each other. And the good news is that everyone's dealing with healthcare burden. US still has $4 trillion worth healthcare spending being done. So everyone does need solutions to solve their problems on the ground. I think everyone wants to do it, but the time is fairly opportune in the next few years. Value-based care is coming in, so that makes a huge difference. Right now, there are about 380 hospitals in Saudi Arabia getting privatized. All of them are trying to figure out how to use technology to become self-sustainable. I think initiatives like value-based care, initiatives like privatization, adoption of AI, and the fact that everyone's grappling with healthcare diseases makes it fairly opportune for companies like not just us, but other technology software companies in healthcare to kind of play a global role.
Thank you. Wonderful session and wonderful comments and thoughts from all of you. So with that, let me thank all the panelists and for their wonderful comments. Thank you for the audience. The audience increased during the session. So thank you, audience. As Varun say, one round of applause for everyone. Thank you.
Thank you so much, moderator of the session. Thank you so much, esteemed speakers, for that wonderful and very, very informative session. Can we request you for a photo opportunity, please? Ladies and gentlemen, this was our panel discussion on therapeutics through technology. And we can always connect offline for further interactions. We now break for lunch, and followed by our panel discussion 3. So do join us back in time for our panel discussion 3, which would be on hospitals of future, delivery mechanisms for the next 25 years. Thank you so much for your attention.
We had a ministerial session followed by our panel discussion. We now move to our panel discussion 3. May I request everyone to kindly be seated? Ladies and gentlemen, our panel discussion would be in and around hospitals of the future, delivery mechanism for next 25 years. India's healthcare sector is undergoing a transformative shift, backed by over 30 billion in recent investments and bold policy reforms aimed at promoting ease of doing business. As the country prepares to add 3.6 million beds and 3 million doctors by 2034, new delivery models such as ambulatory care, daycare centers, and telehealth are expanding access and reshaping the traditional hospital-centric approach. Ladies and gentlemen, our esteemed panel shall aim to explore how sustained investment, emerging technologies, and an enabling regulatory landscape are coming together to build the hospital of the future, resilient, technology-enabled, and responsive to the needs of a growing, diverse population. May I now request you all to kindly join me as I invite our esteemed panelists to the dais. We begin by inviting our Honorable Chair of the session, Chairman and Managing Director, Astron Group, Dr. Y.P. Bhatia. Warm welcome to you, sir. We also request the moderator of the session, Director Management Consulting Healthcare, BDO India, Ms. Avinash Kaur, to kindly join us onto this dais. I also invite our esteemed speakers of the session to kindly join us onto the stage. May I request CEO NABH, Dr. Atul Mohar Kochar, to kindly join us onto the stage. And now I invite CEO CK Birla Hospitals, Mr. Vipul Jain, CEO Care Hospitals Group, Dr. Pavan Kumar, Clinical Head Ultrasound Wipro GE Healthcare, Dr. Rajiv Virmani, Partner and Head of India, Novo Holdings, Mr. Karthik Narayanaswamy, to kindly join us onto the stage. Ladies and gentlemen, at the cost of being repetitive, may I request everyone to kindly settle down with the electronic gadgets on silent mode. This is just to ensure an uninterrupted flow of the event. Now, without any further ado, may I request the moderator of the session, Ms. Avinash Kaur, to kindly take over. Over to you, ma'am.
Good afternoon, distinguished guests, panelists, delegates. It is my honor to welcome you in this session, important session, last though, but important session at Ficci Heal 2025 on the theme Future Hospitals of the Future, Delivery Mechanisms for the Next 25 Years. With the advancements in the digital technology, digital health, personalized medicine, artificial intelligence, and value-based care models, the healthcare delivery in the next quarter century will look very different from how we experience it today. While hospitals traditionally have been seen as physical centers of care, we are moving away and towards a patient-centric ecosystem where hospital technology platforms, home care, preventive health care coverage will all come together to provide that continuum of care. So in this session, we will try to unpack some of these aspects, right? Look at the redefined role of the hospitals in the evolving continuum of care, integration of technology and innovation in service delivery, and how patient experience, access, affordability, and outcomes will all be balanced together. Balancing patient experience and access affordability will be paramount as we scale up. So opportunities and challenges while building scalable, sustainable healthcare in the next 25 years is what we look at. So therefore, this is the point of contemplation for this panel today on how the hospitals of future will look like and how we prepare for this transformation today. So let us come together to hear from our esteemed chair for the session. And he's a recognized authority in hospital management and quality and shaping policy and education. I will hand over the floor to Dr. YP Bhatia, who leads the Astron group. So over to you. Please share the insights with the group and
Thank you,
proceed.
Avinash. Thank you so much. And good morning, good afternoon, ladies and gentlemen. We are talking of the future, and I think since yesterday, right from the time we started with the participation of legends to what we are. As we talk of the future, my thoughts go back to almost 35 years back when I planned and designed the first hospital after coming back out from army, where of course I was involved in hospital planning in various institutions. The scenario at that time, we just had some trust hospitals in Delhi, and most of the hospitals coming up were the trust hospitals. Technology, design, everywhere, we were actually handicapped. Just to give an example, even for the wards and the operation theaters, the vinyl floor was not available in the country. The modular OTs were at that time practically unheard of when it comes to our, even the scenario in Delhi for that matter. We have been evolving. We have reached a stage when by the time I talk or spell the word technology, the technology is changed. We talk of technology, and by the time you install it, people like our friend from GE, they come forward. Sir, your technology is already obsolete. We have something better to offer you. These are the kind of challenges which we are facing. On one hand, we are trying to make and create the healthcare of the future. I remember, when in 90s, I got an award for starting hospital administration as a specialty in India. I went to pay my regards to my teacher, Colonel D.B. Ray. And when I told him about some hospital in Delhi, sir, a beautiful hospital is coming up in Delhi, he asked me a question. Is it beautiful or is it good? I could understand the meaning of his beautiful and good, because functionally, whether the hospital was good or not, it was definitely beautiful. That's where we started talking in the School of Planning and Architecture and other institutions, that you have to be beautiful, but you have to be good also. That's most important. And one word which you find in every hospital's brochure and every hospital's publicity material, state of the art. Now, what's that state of the art? What exactly will remain state of the art? What will be the future state of the art? I think that's something which has become very, very difficult to analyze. Also, a challenge which we keep on facing is that technology is brought in, but people who are supposed to operate that technology, that becomes the most difficult part. One doctor is trained, but is my nursing and the paramedical staff trained for that? When there are failures, they come on the nursing and the paramedical staff. They are no good. But at the same time, has anyone trained them to work on that technology that has been brought in? So as we are talking of the future, as we are talking of so many technologies, one gets bombarded. We are talking of artificial intelligence, we are talking of robotics, we are talking of every possible thing that can come on a medical institution for people to practice that, right from the physician to the junior most person working in the organization. How we become tech ready to accept and adopt and adapt to that technology in the organization, I think that's one of the biggest challenges that's coming up for, as we not only plan the hospital, but when we manage the hospital, right from planning to operating, adaptation of the technology of the future, and accordingly designing the institution to adapt to that technology for the future, which many of us would definitely say. In fact, yesterday it was being said that what will be there after 25 years, we don't know. But while I'm planning an institution, I'm told that at least plan it for next 100 years. So if I don't know 25 years, how do I plan it for 100 years? And while I'm putting across the technology to operate it, the adaptation of the technology is probably one of the most difficult challenges coming up. I think, to address many of these, including financing of these requirements, because every time we talk of technology upgrade, the budget comes along with it. And how to make sure that the institution remains viable still after adopting and adapting that technology. I think we have a very eminent panel over here trying to address to those issues. And I request Avinash to please carry on
Yes,
with the topic of the today, and we'll intervene in between where we discuss, as we discuss and
Right.
go forward.
Thank you so much, sir. And very well said that when we are looking at, a foreground of 25 years, we have to also keep the next 100 years because these things that we are creating are meant to last. So thank you, sir. Thank you for that, setting that context. And in that note, I will call Mr. Vipul Jain over to talk about how hospital designs and adoption of technology, cultural transformation, all will contribute towards an holistic hospital patient journey in the future. Also, at the same time, I request him to shed some light on how sustainable infrastructural practices, design practices, energy efficiency, and responsible procurement will play a role in the future.
Okay. So, good afternoon, everybody, and thank you for being here after the post-lunch session as the last session of the event. It's been an honor for me to be here for the last 2 days, and special thanks to Varun. I probably the best conferences I've attended in the last many years. Thank you for organizing this, and sir. So, first and foremost, I'll be very humble to also accept that what will happen 25 years. Yesterday we were saying Bhagwan hi janta hai, right? So with that context is what we will share. I do believe that, and I agree with many of the fellow delegates that the path that our country will take in the next 25 years will be different than the path which has been taken by many other developed markets. We have done so in telecom. We didn't go through the whole landline proliferation. We went to the mobile. We have done so in financial services with the kind of digital payment infrastructure that we have set up. We have probably been on the healthcare side, still been a follower, but probably the best minds and the best people, the human capital that we have has served the world. Um, I was uh, I was understanding that almost 50% of the doctors in US, come from some Indian origin or Indian background. So that's a huge number. Uh, so hopefully, as we go forward, our path will be very different. I do agree that technology will play a very, very important role in that path. Uh, what took 100 years probably can get done in 10, 15 years going forward. That is the pace at which things are moving in many, many areas. So with that background, I'll say uh, there are 5, 6 elements which stand out. I'll talk more from a breadth angle. Going forward, hospitals of the future and healthcare of the future should evolve into. First, I think we will move from episodic care to more integrated care. It's a theme which we have started seeing as well evolve, but it will become extremely, extremely visible across the length and breadth of healthcare that we provide. Uh, we were talking from sick care to healthcare, right? So almost, be it wellness, be it mental health, be it starting from wearables to home care, the entire value chain of delivery. I think that will become more integrated, that will become more connected, networked, and data driven. So, definitely one trend that should happen, and we should see it in hospitals of the future. Second is extremely standardized and protocol driven. Uh, we struggle these days. While we talk of quality, we were speaking yesterday about how it's difficult uh, to measure and compare and give choices to patients accordingly. I think over time, this is one element, at least in Indian healthcare, that we will be able to solve. We will get a lot of standardization and a lot of transparency and visibility into the quality of care. Third, I think this is something I hope, although I don't know if it will happen in 25 years, 15 years, or 40 years, but I really hope that we move very significantly towards predictive and preventive care. Um, I hope my kids and the next generation are more careful about their health. We don't end up becoming the diabetes capital of the world for the next generation, or the chronic disease capital of the world. So technology will play a lot of role in this. I mean, from a very simple sugar monitoring to a digital twin, predictive analytics, to your gene testing. I think these are elements which will give people opportunities to assess the impact of their actions on their health, and hopefully we should see much more preventive and predictive health. Fourth, I think we spoke a little less about it, but longevity should be a big trend going forward, right? We talk about 70, 72 years of lifespan. I think it's not beyond the realm of imagination to live for 150 to 100 years. I personally believe, at least my kids and people, the kids who are getting born today will have a lifespan which will cross 100, 150 years. The technology is coming, and the opportunity, this may not be equitable, but the opportunity will be there where people will live that long. This will mean a completely different opportunity set and challenges for healthcare. There is a fair bit of ethical questions around this as well, but again, this is a trend that should happen. Yesterday and today we spoke about AI driving care. I believe while a large part of AI over the next, again, 15 to 25 years will still operate in the co-pilot manner, but I think autopilot is also a reality that will happen. I One of the very early signs of this is investments, right? If you see world over, uh, we know about the FANG stocks and all the how the market cap of some companies is as big as our country. Uh, but if you see how the money is flowing, it is flowing into technologies and assets which will be which will make it less dependent on humans and can go at scale, right? Just for example, you will find the market cap of some robotic equipment companies is more than the market cap of a lot of medical devices companies put together, right? I'll not name the brands, but it's very easy to guess. So this is the way the world is moving. So it's not possible. I mean, 25, forget 25, 5, 8, 10 years back, I used to go to a bank every week or every month, right? Somebody from my family will go to a bank. It's been years I've not gone to a bank. Right? So this is how things will proceed. This is how the money will support the technology. So you were talking about the financials, but this will make sense. Last couple of things, I think we should see significant decentralization. We were talking yesterday about tier 2, tier 3 opportunities. I think these opportunities are very real. Uh, this will The models will be very different. Maybe high-end quaternary care, transplants, etc., will still remain in a hub model, and the spokes will take care of the primary care, secondary care. Technology-led will also ensure the quality of delivery and standardization, as I said. Lastly, I believe to a large extent, at least at the primary, secondary, and tertiary care level, we should see equitable access. Uh, I hope even on the longevity front there is this opportunity. But yes, these are elements on the broader how hospitals and healthcare of the future will be. I'll also just quickly touch upon the sustainability element.
Yes.
Uh, I believe we as we as the industry who is representing healthcare, while we always say we will not cause any harm to our patients, we should find ways that we don't cause any harm to our environment as well, right? Because eventually the environment affects our patients who come to us. Uh, there are 4 5 ideas. I think we are a large consumer of resources, be it energy, be it water, be it materials, etc. So recyclability of that, renewable energy. There are already uh, solar facade glass opportunities available. It is still not ROI positive, but it is available, where you can have a decent facade and it will still generate energy. Uh, Natural lighting, I think, more technology, AI-driven building management solutions, smart windows, etc., etc. They are all coming in the light. I think reusability of water and materials will be a big thing. We have started doing some of that in our hospitals. Also, hopefully, it should get incentivized or penalized by the government more. Um, I'll say waste management is a big topic. We generate as hospitals a lot of waste. Again, if we can reuse and find ways in which the material choices are such that they can be reused, I'm pretty sure this is the way. The quantum of waste that we are generating, that's not very sustainable for a long term, and I hope solutions come in that as well. Lastly, I think climate resistant, climate resilient solutions, which save energy and save resources, are something that should also evolve in future. So these are some elements from a design and an infrastructure angle that should come in. Again, many of them, while they are there at idea stages and some startups are there, they are not ROI positive. So hence adoption is minimal. But I think economics has driven many choices in the past. So now we do solar energy at 1 rupees a kilowatt versus it used to be 15, 20 rupees a kilowatt when it started. So this is a matter of time. I think it will happen.
Certainly. Yeah. Certainly. It's a matter of time till we adopt sustainable healthcare practices. And we definitely see those sustainable healthcare practices, climate resilient practices, procurement, efficient energy utilization in the future. And also, thank you for covering the length and breadth of how the future will look like with technological advancements, moving from episodic care to integrated care, and definitely a focus on active and healthy aging is a part of the future. So I move on to my question with Dr. Pavan here, and he's at the helm of Care Hospital, committed to quality and accessibility. My question to him is, how can future hospitals balance innovation with this timeless element of caregiving? Right, and then we see a lot of different types of partnerships will emerge in the future, right? Public private definitely, but hospital tech and hospital home care can also be one of the futures we see right now happening. How do you see these changes coming about in the future?
Thank you, Avinash. Thank you so much. I must thank Dr. Harsh Mahajan and Varun for having me here. And thank you to the audience for putting up with the post-lunch session. So, Avinash, I think this is the fourth session on technology since morning, technology in healthcare. And couple more sessions, I would have declared that we'll soon have a AI hospital.
Yes.
So I think that much of technology we have been ingrained with. But I think the key takeaway for me as an operator is that uh, we are not talking about AI hospital. We are talking about human hospital powered by artificial intelligence or technology to say. And that's the essence of healthcare. That's why we all exist. We exist to serve the humanity at large. And technology today is the biggest enabler for everything that we have heard in last 2 days, as a challenge and as an opportunity both, whether it's about accessibility, driving affordability, driving early detection, prevention. One of our friends here was telling me, any conference we go, we hear just 3, 4 things: accessibility, affordability, prevention, and then we go back to our boardrooms and we hear some other matrices. Yeah, profitability, EBITDA, ROI, and ROCE,
Right.
and that's so true. But I think the one way to balance both is technology. Uh, it's in a way to say, if you deploy technology in the right way, it will just take away the frictions and so much of administrative bandwidth that is taken away from a caregiver. And then caregiver could sit by the side of a patient and do what is more human. So I think that's the role of technology. If we envisage the role of technology like that in healthcare system, I don't think we are saying technology as an impediment to human hospital, but it's an enabler for a more human hospital. Uh, I think what is not human is to delay a diagnosis, not reach a speedy diagnosis in time, and hence delay a treatment, and hence lead to a poor outcome and poor quality of life. Today, technology can enable all that. We could reach a blood culture report in hours. We could start definitive antibiotic treatment within few hours of ICU admission. We could get a patient out of ICU within a couple of days. I think all this is possible and leading to a better quality of life post discharge, which we as providers we never envisage. We do not monitor. We do not count about. I think that is human to care for that life beyond hospital, and hence we need the technology to reach there. We talk a lot about accessibility and affordability. There is so much of care divide that exists in this country today. There is this India and there is that other India. And I hear, people like Dr. Suchin Bajaj serving the other India, reaching in tier 3 cities, tier 4 cities of this country, using technology as an enabler to provide access to millions who would not have been served otherwise. I think that is about building a human hospital, the human healthcare. So I think technology is only enabling us in providing more human care, in building more hospitals which are more human. It's nowhere an impediment. And like I said, it's not a digital or AI hospital. It's a human hospital enabled by digital tech or artificial intelligence. However, the matter of ethics will always prevail in tech adoption, like Vipul mentioned. CRISPR as a technology, when it came, I think it was a thought that will create some Frankenstein's monster again. But what CRISPR did to humanity at large, we all saw during the time of pandemic. Uh, I think again going back to the first session, the session of legends, the soul has to prevail over mind and our actions, and it has to guide our actions. So, so technology adoption, yes, but I think soul taking precedence over mind, and hence leading to building human healthcare and the human hospital.
Certainly, sir. Anything you would like to add on the role of different types of partnerships that will exist in the future?
So a future hospital cannot exist in silo or isolation as a hospital in its own right. I think future hospital will exist in a network or an ecosystem. Now that ecosystem cannot be built by a hospital provider alone. It has to be built by multiple partnerships. That partnership has to evolve with hospitals amongst each other. That partnership has to evolve with hospitals and technology partners. That partnership has to evolve with the government and the private providers. I think the amount of access that government could drive and the agility that private providers could bring in, uh, both are critical to seeing a hospital ecosystem of future. Similarly, a technology in isolation without having access to the kind of data that government is enabling. We hear 74 crores healthcare uh, patients' data has been routed through ABDM. Now that's a huge data. The world cannot envisage. I think that partnership collaboration of that ability to use that data provided by government, by our medtech and health tech players, uh, could do wonders. I think it's difficult to envisage what all it could bring out. Even today, we do not have a single AI-driven platform which is developed for India in India by consuming data of India. I think we're still looking forward to it. So yeah, a government private partnership is a key enabler. Similarly, the partnership amongst hospital is crucial. I always say that we are not competing amongst each other. If at all anything, we need to collaborate more and more. because I think we need to create another 10 lakh beds, as we heard today morning. And there is a lot more that each one of us could bring together. So to sum up, I would say technology is making healthcare smarter, but only empathy will keep it human. Thank you.
Thank you so much. Thank you. Right, and very rightly said, yes, that human hospitals, but enabled by technology, enabled by AI in the future, is is definitely something how we can imagine the future now. We can't imagine any other future where technology will not exist, and there is no other space in the healthcare where other than diagnostics, which has taken this up in such a huge stride and has adopted technology with great speed and great precision. And on that note, I would like to invite Dr. Rajiv Virmani, who has been leading clinical application, education, and adaptation of advanced imaging technology. And I would like to ask him that as health technology rapidly integrates, right, with AI, automation, how do you see its role evolving, and how will technology become more accessible and affordable, right? We that that even though those words are so repetitive, accessibility, affordability, but that is the underlying words for our country: accessibility and affordability, and ensuring that all communities of all sizes have access. So over to you, please. Do shed some light on this.
So I represent MedTech, and I think there is a technical error. My mic is not lighting. I hope somebody can. I think they've kept it from that. This is working? Okay, sure. Thank you. So good afternoon. I hope you all are awake. Can we latch the door and close the doors? You're not allowed to leave now. You've already set in. You're into health. I'm just kidding. Just kidding. Please go. Yes, sir. Okay. Is it fine, sir? Right. Thank you. It's a pleasure, and I didn't eat lunch, so I can. So, but it's a pleasure and honor to talk in front of stalwarts and people like yourself, sir. And where Dr. Bhatia was trying to bring about the innovations and the speed about the changes. It's the only piece. I'm not going to market it here, but the only thing is about the customer centricity. Whenever there is a change in technology, it's about the customers' feedbacks that the companies have to listen to the people who's sitting in the front, who has taught me the radiology and technology, and I'm speaking in front of Dr. Mahajan today. It's really tough, but I'm feeling honored, that somebody who has taught us technology, I'm trying to showing the torch to the sun today. But I'll try my best and share something that, what is happening from AI piece in terms of the medtech and the hospital scenario in the future. So, I'll talk a little bit about the present scenario, that, what is the present status. Everybody is talking about AI. And I think we'll have to stop saying that that is the future. We are already into it, and we have to adapt it. And you can say that, how we are adapting to it, whether we are imbibing it, but it is part of our lives now, right? So the only thing is that how well we utilize this to our best clinical outcomes, clinical safeties, and of course the ease of doing work, so that the throughput is much better. Do I have to move it a little? Is it fine? Okay, perfect. Okay. And yeah, one other point that he was talking about, Vipul brought out about the precision and the care pathways. I think you were talking a little bit. So I think that is the future. Everything will go towards the care pathways about the super specializations. Let's say, take an example of the NCD disease burdens that we have today, and specifically talk about the cancer. Dr. Mahajan just recently diagnosed somebody in our known. So what is happening to the cancer care? It's from the gene. So you talked about you said the predictive and the preventive. I'll just add one P to it. That's the personalized treatment. So it's going to be a very, very bespoke treatments in the future. If I talk about future, how AI is going to help, we'll start with the particular. You said about the protocols. That's fine. We're going to follow the protocols, but the protocols will also have some limit, because it is going to be very, very personalized treatments for a person from a different family, from a different gene mapping, will have a different treatment planning altogether. So we are heading there, right? And so everybody is talking about the investment in AI, and the global momentum is there. If you know the AI investments into the industry of the only in healthcare I'm talking about, it is going to grow from a CAGR of 35%. That is one of the highest CAGR in the next 5 years. So everybody's talking about AI in some piece or the other, right? So that's one piece. And disease burden, I've already spoken to you that NCDs is something that is taking a toll on it. And this is where we are sitting right now. I'll talk a little bit about the potential of AI in the future healthcare that we are looking at. One is the diagnosis of the disease. Somebody mentioned about the pathology reports and the how well and how quickly we can get the results actually. Similarly for imaging, and I'm quoting Dr. Mahajan so often today because he knows more than I do in terms of the automation, the AI, and what can be done out of an AI techniques basically to get the best clinical outcomes and how well it helps in the radiology reporting, right? So that's one piece of it actually. So that we talk about the one is the potential. Second is the predictive analysis itself. The AI helps in letting you know, this is for you from the hospital background, so that where should the triage be done? It has the capability to know that if this is the data that I have collected, where should your resources be putting? Everybody, you talked about profits, are added the point of profits to it. So where the optimal resources have to be managed as per the data that the system is collecting. That is the future of AI. So as soon as it collects some data, it knows that what needs to be done, which patient needs to be taken where, and which needs to be given more priority. That's and the last to this is basically that we have data from everywhere now, right? You have the clinical data, you have the demographic data, you have the economical data, right? You have the phenotypic data, you have the geographical data. Every data is captured everywhere, right? So this data, how do we take care of that? It's very fragmented. But if you have a platform or if you have a cloud-based server that can take care of that, that is something that actually will lead us into the future. That this cloud-based thing that will amalgamate everything into this data, and this is where we are lacking right now because they don't talk to each other. There is the lack of interoperability. So they don't talk to each other. Two modalities, two things, two different areas where I'm getting the data, they're not cross-talking. So that is the biggest challenge. So I've talked about the potential. So the challenge is, if I talk, I'll start with this data interoperability only, that these are not talking to each other. So we need to have certain platforms where all types of data of that particular person, that particular race, that particular family can be captured, and that can be used for the AI basis outcomes, that what needs to be done for that particular thing, right? And the challenges, if I talk about, I see that the digital infrastructure, we talk about AI, but do we have the relevant and appropriate digital infrastructure to look into that, what is required to set up a good AI base? Yeah, you're talking, Dr. Pavan, you said that, I think, about that AI, it's away from the humans, right? We have to keep it separate. So yes, as a G, it's our policy that we want to augment what is present right there. We don't want to replace it. I've heard him saying number of times that AI is not going to replace radiologists, but AI is definitely going to hurt radiologists who are not using AI. So it's a very deep statement that you have to start adopting to AI. You cannot say that I'll follow what I was doing 25 or 30 years back. So you have to bring AI into your clinical practice so that you start accustomed to the present and the futures of the AI. This is one thing. So lack of interoperability, and yes, the most critical piece from an Indian point of view or a South Asian is the technical skills. Sir, you're mentioning about the education initiatives that you have taken, or this is the biggest thing. We might be spending $1 billion in R&D every year, but if my customer or a user or radiologist is not able to utilize this technology to its full, it's a waste. People are hanging their clothes to dry on a treadmill. It's something like that. You have invested in technology, latest softwares, but if you're not using it, then it doesn't make sense neither to you nor to the R&D people who spent 5 years or 10 years to bring that technology to the place. So that technical skills is equally important, so most important piece actually. So I'll come to the little solution that what can be done to actually start integrating what needs to be done. So I talk about the digital infrastructure that is required, right? That's the most important piece. And the investments, of course, will be required to integrate AI into the present situations. But most important thing is that we need to understand what is the urgent priorities for our local Indian scenario. We cannot be just following what is happening in US or UK. We have done a lot of reverse brain and now we have been following that. But I think it is time that India stands out and start looking at their own data. They start working on the local priorities, what is required, and start building something around that. In that phase, I think the government's initiative towards Make in India also helps, truly helps. And we are too much into Make in India. We do a lot of products in India now. And the most critical piece that I feel is if you see the healthcare, this is a basic golden triangle: accessibility, affordability, and quality. We keep talking about every time, right? So if the AI has to really work with people like the CEOs who are sitting here, they would always love to have a great hub and spoke model for them so that somebody in the periphery can do some initial diagnosis there and refer the right patient to the tertiary care centers, right? If that can happen, that will be truly a great AI innovation that gets into that. So accessibility is the most important piece if AI can take care, so that the disparity in the healthcare that is provided at different tierings of the cities can be taken care of. I'll show you an example. So somebody who started an ultrasound would occupy a full room. If you can see now, this is a probe that has the capability of doing an entire ultrasound. This is the dummy. So just for the PNDT confirmation, this is the dummy. Okay. Yeah. This is the plastic dummy. Okay. Yeah. Yeah. So this is the dummy. But I'm just showing you, I came from a sale training and I was telling them how to use that in a laptop. But this is what a system does today. You start with the room where we had a full room that used to use for ultrasound. And now if this goes to the periphery or the tertiary centers and you take care of a teleradiology and give them a confidence of, at least sending the people that something is there that needs to be treated at a higher center. So I think this takes care of the accessibility. So this is one of the things actually that we are looking at, that how can we improve the accessibility. And the last piece that somebody talked about, the collaborations, Dr. Pawan, you were mentioning about. So collaboration is very important between medtech, government, initiatives. You have brought us here, invited us here. It's actually a collaboration in that domain as well, that you're giving us a stage to talk about this. Thank you so much for that. So, and I'm proud and honored to say that G has recently been part of one of the programs with Ministry of Health and Family Welfare, where they are leveraging the AI into creating centers like AIMS Delhi, AIMS Rishikesh, and PGI Chandigarh as Center of Excellence. So it's about the development and creation of new technologies and spread it everywhere. Not just for our case that we will use it somewhere, but it is for the adaptation of these things. So the centers like AIMS, we all know, sorry, what brings to the table to the AIMS. So they will be creating, co-creating. It's a perfect example of medtech coming along with the ministry. So these kind of initiatives actually bring everybody together for the best of the safety. The last piece that I would like to say is that AI is there, but you need to be very, very responsible in using that, because we have to always bring in the component of the data scrutiny, security, and the privacy and there has to be a good governance around it. Otherwise, we actually can be getting into the movies that you see, that the machines and the robots are controlling humans. We might get into that stage. So we have to keep things under control. We are going to augment our things with AI rather than they controlling us. So I think I would hand it over to you back. So this is where we would like to do the show. Thank you so much for that.
Quite a thing to pull out on stage, like a point of care device, yes. And you kept it secret because we've been interacting and you never showed that earlier. Right. But yes, definitely point of care devices will ensure accessibility, and that is one of the areas we should look at. Another point that you made about interoperability, unless the data is talking to each other, right? We're all creating so many different silos of data, and actual decision making is not being enabled, or the patients are not getting that information, carried from their one physician to another physician, or from their one test to another test. There's no continuity or longitudinal data mapping until interoperability is taken care of. But with the speed at which the the scenario is evolving, right? The hospital designs are evolving, the technology is evolving, its adoption is evolving, new caregiving pathways are getting emerged. Regulation has to play a very big role. So on that note, I would like to ask Dr. Atul Kochar, who leads the organization's effort towards promoting patient safety, quality benchmarks, and healthcare best practices, that how is NABH planning to evolve its accreditation standards to address these changing needs of healthcare delivery, and as well as hospital infrastructure, not just care delivery but also infrastructure over the next quarter century.
So thank you so much, Avinash, and I'm immensely grateful to the leadership of Vicky, Mr. Varun, Dr. Harsh, Dr. Lal, and Dr. Puri sir, and the entire leadership for giving this opportunity. So it's been a great discussion. I was thinking I'll be the last, so I'll take a little bit of all and sum it up all up. But it's been a fantastic discussion, and the Vernian concept, what the Vipul said. I mean, so how far into the future we are looking at? You limited me to 25 years, but I think it's been the concept of hospital has to change. The hospital as a building, to hospital as a network, to hospital as an integrated digital ecosystem, what he just mentioned. I think the technology, the AI, the very concept of hospital will change, because quality and accreditation are somehow linked to that, because quality as a compliance was what we used to practice. You there was a checklist, there still is, that you conform to these 10 points or 5 points or 200 points and we'll give you a certificate, to a culture that you train people, then you retrain people, and then you do drills. So that something is currently. But future is all about quality as an intelligence, because the concept of beds will evolve. Mr. Pawan mentioned the 10 lakh beds. So probably your home bed is going to be the hospital bed. That's been an allotment, and probably they'll give you a number also for the bed, and something. So and that will turn into a node in the ecosystem. That's too far, but not too far also. There are already places on the globe right now where people 70 or 80 years of age are aspiring today to live up to 150 years. So that's a reality. It's not ROI positive as Vipul put it, but on the bay side, on the west coast, these things are already happening. As we speak, they're happening. So what is probably the rural India for us today? We are the rural part for those people here right now. So that's a reality. That's why those celebs delivering babies by surrogacy. I mean, it's you call it a conspiracy theory, but it's all out there, and people with deep pockets, somehow can aspire to do that. Organ harvesting, stem cell tweaking, all all that is happening right now as we spoke, and you don't have to go to the dark web also to find it out. It's all there in public domain. So that's one thing. But quality, like I mentioned, what we are doing at NABH is we are taking one baby step at a time. We are being guided by some of the leading. Dr. Puri sir is one of our chief advisors. So many of us, they're guiding us. So we are building a modular platform. And the next 3 years probably are going to be committed to outcome monitoring. Rather, in 6 months' time, we are on 15th of November to be exact, we are launching the modular platform where each hospital's data will be fed. By 1st of January, we are going to start collating that data, and by middle of next year, you will have some sense of what a hospital outcome looks like. So that's not probably too far into the future, but very touchable distance there. By June of next year, we'll have some concrete data on 12 parameters about what uh, award should look like. So the awards which Ficci Heal and Dr. Bhatia and everyone promotes, so and rightfully so, we shall be able to provide some objective fodder for them. That on this basis, this hospital for these many diseases, at least the 12 parameters, and Dr. Puri, thank you, sir, for leading us into that. So that's another thing. Grading of hospital is a reality, basis the accreditation. That's a framework. We just want a little bit of government buy-in before it kicks off. Already pilots have been done for past 1 year. 14 hospitals have been piloted. 30 more are in pipeline, and thank you, sir, for actively promoting that. So there also for Venkateshwara Hospital. So there also hospitals can be really benchmarked against the best in the world on certain objective parameters. So what really means that? So that is something which is within the distance. But quality, the concept of quality has to change. I mean, it cannot be you fulfill this today. The sampling exercise will be real time. The data will be monitored real time, and probably, but that's again, it probably is already happening in parts of the world. How far we can adapt in India is the query. But I'm eternal optimistic, and all those things what Mr. Vipul said, Mr. Pavan said, and Mr. Rajiv also said, I think they make so much sense, but probably not in 10 years, 25 years, probably in near future. Thank you.
Thank you so much, sir, bringing in the point of view about quality and outcome monitoring. So the final speaker that I would come to is Mr. Kartik Narayanan Swamy. He oversees Novo Holdings, and he directs investments in hospitals, medtech startups, and health platforms. So my question for you is that what are the factors that are most critical while deciding to back a healthcare platform or an emerging medtech innovation or any technology that you invest in, that, and how do you balance these financial returns with long-term societal impact?
Firstly, thank you. Thank you to the Ficci leadership. Thank you, Dr. Harsh. Thank you, Mr. Varun, for having me here. It's an interesting question because my fellow panelist out here, Pavan, just mentioned things are different in the boardroom versus in other places. I can speak for how we look at investments. I'm part of Novo Holdings. We only focus on healthcare and life science investments. We have around 180 investments globally, 6 of them in India. And when we look at investments anywhere, I think the first thing and the most important thing is the clinical parameter, depending on what it is. So in hospitals, are they differentiated clinically? And the reason being, if you look on this panel, I'm perhaps the only one who's not a doctor. Everyone else is. And that's an area which we don't have expertise in, right? So we need to be able to find someone who is very differentiated, even in a life science investment. We have enough people in our team who understand this in depth, but we require or want to ensure that the company we're investing in has that differentiating clinical differentiation. I think the second thing I'd say is just the operating metrics. I think every investment has a different set of operating metrics. If they're able to execute to those operating metrics, I think that matters significantly. I think we are long-term investors, so we don't look at investments just for 3 to 4 years. We are happy to hold on to investments for 5, 7. Some of our investments we've been in for like 13, 14 years because all of it is proprietary capital. Healthcare, life sciences are long gestation projects. And so if you're able to execute correctly, if you're able to have the operating parameters, I think that would be the second second thing that's important for us. I think the third thing would be the management team, ensuring that you have the right people backing it. And then lastly, the financial metrics. I mean, that also is important. But if you have the first 3, what we tend to see is the fourth item follows itself, right? As Novo, we back, I think most important thing for us is innovation. I mean, one of our most innovative products, obviously, from our portfolio company, Novo Nordisk, is obviously been the GLP-1s, which has been a 20-year overnight success, right? It's taken 20 years to develop it. And now so we recognize that some of these things take time. And I think each of the panelists have said it quite well. We say future tomorrow, but future is today. And where we are, 3, 4 years from now, we ourselves sometimes will be very surprised as to how things are. One of the companies we've invested in is a company called Cure.ai. This was when AI wasn't sexy. AI wasn't a term that everyone is using. But today you can actually see that the work they're doing is moving forward. So for me, that's the order of importance in terms of how we look at investments. Your second question in terms of impact, I mean there was a good point made yesterday and repeated today about using your you need to figure out health from the soul. I think at the end of the day, that's important. We are owned by a foundation, so a large chunk of the profits we make actually goes back into society through the Novo Nordisk Foundation. So we have educational grants, research grants that are given. For example, in India, we spend a bunch of time focusing on improving midday meals. We focus on training of nurses along with AIMS and CMC Vellore. So there is a soul somewhere there, which then ensures that we are guided in the right manner. It is important because it's very easy to stray. And what I've seen in my 20 years of investing is that when people stray, you eventually get into trouble. And that's why, unfortunately, you find some of these issues and challenges with certain, healthcare healthcare service providers, right? But where most of these stalwarts out here and people who have actually grown and compounded over the past few years have actually thought of it as a sustainable business in terms of creating impact. And so while we are not impact investors, our investments end up creating the right kind of impact, and we're very proud of that. So for me, it's a privilege to be able to be in this room because I learn every single day, and there's been so much talk about AI in general, but my personal view is that things will just move so fast, and all of us will catch up as we will need to.
Thank you. Thank you. I hope all medtech startup innovators are taking notes on this aspect. Right. So on this note, I would like to open the floor for questions. If there are any questions from the audience, now is the time. You can ask any questions you have regarding what the hospitals of the future will look like. And from any of the esteemed panelists, specifically, if you have any questions. Yes, sir.
My question is to Karthik. Karthik, we are seeing a new phenomenon these days, and that is that there are companies both in in providers, of course, hospitals, pathology labs, etc., whose EBITDA is negative, and yet their valuations are touching the roof or going through the roof. So how do you explain this? Is it just plain simple speculation, or is there something else behind it?
So I think it's to a certain extent. Firstly, I don't think it's sustainable. Let me start with that. I think it's there's a bit of demand supply out here. I think there are enough people who recognize that there is an opportunity that exists in healthcare in India, and are trying to quote unquote play that opportunity in a different way, or different ways. For people who perhaps are not deep into healthcare, I think healthcare is not just one vertical, right? There are multiple verticals that exist out there, and that's where it's advantageous to be a healthcare focused investor. But if you're not, then if you believe that the multiples will continue at these levels, people are like, let's perhaps go on in that manner. So my personal view is that at least we at this stage look for businesses which have cash flow, look for businesses which are sustainable, right? One of the reasons today perhaps you don't have something on the you have like big consumer tech plays out here today, you have big fintech plays out here which have gone public. Again, not all of them have been properly profitable, but have gone public. You don't necessarily see that on the medical side, is because they've not gotten to that scale, and the economics at the long run has not been proven out. So the short answer is it's a demand supply mismatch. There's a lot of capital chasing few deals. Even today, you don't have enough good diagnostic centers, you don't have enough good hospitals, but you have a lot of capital which is out there. And so some people take the educated bet. I think some of them might be proven wrong, especially if that business is not able to become sustainable on its own. We've seen examples where, you know, people have said that, hey, we'll turn profitable in 2 years, 3 years. We said we'll wait 2 years, 3 years and then invest, right? And they've not. And so it's turned out to be the right outcome for us. There have been places where I've been proven wrong as well, where we've invested in someone and we were told that, you know, we'll turn profitable. They did not turn profitable. However, someone else was willing to pay a significantly higher valuation for it, right? So those losses I'm willing to take, but we want to make sure that it is more sustainable. So will our EBITDA multiples in hospitals remain at, you know, 35, 35x? Perhaps not. Will it come down to the US numbers of 10x? Absolutely not. I think that's somewhere in between. And as long as the operational growth moves forward, we should be fine.
So how do you enhance the India growth story, especially in healthcare, hospitals? What is your suggestion? How would you like to?
I think we need more capex. We need, you know, I do not think we have enough hospitals. If you add the market cap of all the hospitals, publicly traded hospitals in India today, it is less than the market cap of HCAH in the US, right? And for the number of people we do not have the hospitals. Like, I think COVID was a very, very stark reminder to all of us, right? I think I've been in healthcare for a long time. I could not find a bed, right? I actually realized what it felt like if you were a person in a tier 2 or tier 3 city without access. And so I feel like it's our due. I mean, as investors, we will continue to invest in areas where you'll continue to get that level of access. But there is still a big capex cycle that's required. So I'm actually pretty excited about investing in healthcare in India today, because I don't feel we are at the fag end of the journey. I feel we are just starting. We just need to do it the right way. That's all.
Thank you.
Dr. Kochar, actually, there's something that we should be looking at. For every hospital, the patient is the fulcrum. And depending on the specialties that the hospital plans and the patient flow, that needs to be factored in for a hospital. So, and obviously with that you add technology. I'm just sharing an example because way back in 2002, Otis Mohali, a retired teacher from one of the prominent schools of Shimla, had just retired. He had come, angiogram was being done. It was a proximal LED block, and he started sinking. Just because the planning was good, the cath lab, the OTs, we massaged him and took him to the OT, and he was operated. What I'm saying to say is that plan the areas that way. So sometimes just, as you said, that it should not only look beautiful, it should be good also for the patient. The flow has to be properly planned. That's my submission.
No, you know, we've talked a lot about AI and that it's already here. It's not in the future. What we see in radiology, in pathology, also maybe cardiology and neurology, is that the current algorithms that are there have niche applications. You know, there'll be an algorithm saying I can diagnose TB on a chest X-ray, or like Dr. Paul said, some 5 or 6 things. Then there'll be something for lung nodules on a CT scan. Similarly, so ultimately, in the body, even if we look at just radiology and imaging alone, there will be 400, 500, maybe even more algorithms that will need to be used, unless you get some omnibus algorithm which does everything that a radiologist does. May happen in the future, but it'll be probably much distant future. Then hospitals of the future, if they are going to actually use AI, then it's not just the radiology and pathology department that will use. Each and every department will use it, not just for diagnosis, but also for treatment. In the OPD, the physician or the surgeon will put together the diagnostics, and then probably, hopefully, an AI will tell that these are the 2 care pathways or 2 treatments. Now you choose out of this, or maybe it'll give only one. That time will tell. Now the question is, when so many different algorithms are going to be used, and you know, 500 algorithms may come from 200 different developers, because everyone is building 1, 2, or 3. So the question that we faced actually in 2018, we saw that multiple algorithms being built, nothing being used. And even today, if you look at different parts of the world, even though we say AI is here, very little actually is being used in day-to-day clinical practice. So there actually, someone said nothing has been built in this country for this country or the world. Actually, we, group of youngsters with us, they said we will build a platform where any and every algorithm that you want can be housed. So it becomes like a marketplace, more like a Google App Store for AI algorithms, where most importantly, there would be validation and testing, which would be necessary. During COVID, so many algorithms were built, and we would hear 98% accuracy, 96% accuracy. And when we tried it, it would not even be 50%, which is like a coin toss. So, validation, very important. How do you build trust in an algorithm? Because you can have such different, varied data. A Siemens equipment versus a GE equipment or a Philips equipment may give very different data. So, to be able to validate on your own scans, to know how much faith or trust you have, how good it is, to be able to tweak the algorithm. Dr. Paul talked about sensitivity, specificity in the morning. Can we actually tweak that? Because AI algorithms are nothing but thresholding. At what threshold are you satisfied? I want 100% sensitivity. I don't mind some false positives, because ultimately the positives, at least for the foreseeable future, will be seen by a human radiologist or a human doctor. And then, with 200 different AI developers coming with 200 different systems, 200 different wires, can they even go into a hospital information system or a PACS system? They cannot. So that's where in this country was built this AI platform for the first time, which can house any and every algorithm, 500, 100, 200. There are currently about 180 on it. And I'm quite happy to tell here to a very, eclectic audience, this is the only AI platform, one and only, which has US FDA approval, which came in May of last year, which has CE mark, which came in October of last year. The Australian certification, I don't know what it's called, and the Singapore government uses it for all its public hospitals. So it's not as if India has not done something. Cure.ai, Karthik talked about it. It's the number one company for AI algorithms in the world. They have 4 or 5 now. And in fact, the first paper that ever came out on AI in the Lancet in 2018 came from Cure AI and our group working together. So we can do it. I think the money is there. Karthik, of course, is only too willing. He says too much money, don't know where to put it. I think the youngsters need to really stand up and be counted. And here I would also repeat something that has been said these last 2 days. First, identify the problem and find a solution for it, because we've seen too many times these IIT youngsters and young doctors will come with a solution, and then they are trying to find which problem does it solve. So I think there's a lot to be done, but to say that AI is here, it is here, very little in use.
Can I just add, Dr. Majan, one thing? And you're right, we are working with 5 AI startups as a hospital. Cure.ai is one of them on small things. And I was challenging Rajiv, saying, why is a radiology vision AI startup existing? You spend $1 billion. Why don't you only make it? Because it's eventually going to be in your vision. I will only request one thing, which is a request. The larger request is, I believe there's a winner takes it all in many of these things. I mean, there was a time somebody started WhatsApp and was bought over by who. Somebody started Instagram and is now bought over, etc. eventually the consolidation game will come in. A lot of these startups today at the back end are using large language models, which is a MedGemma or a MedLM or a ChatGPT and so on and so forth. Maybe the race on the large language models is already far ahead, but at least with the place that you are saying, creating platform for AI companies, maybe SLMs, maybe certain specific ways in which we can come together. If the capital can fund an India-based AI opportunity, it can be something that we can be proud of rather than only be the back-end service providers on technology. So would request, yes, we as hospitals would definitely want to support this. I am happy to share our data. I'm sure we can find ways in which we as hospitals can come together. But any India-based AI platform, software companies is what we should support. Eventually, it will be winner takes it all.
Maybe I'll differ a little bit with your permission, Avinash. Uh, the Gs of the world tried it. They, all of them, GE, Siemens, Philips, everyone tried building that, that we will house only our algorithms and they'll go on our machines. So you have two kinds of approaches. One is that you build the algorithm, it goes on a machine, and whosoever buys that machine gets that algorithm. And then you have, but to think that one company, one entity will be the repository of all wisdom and will be able to build the best.
Platform.
Platform is what we said.
That's why
Yes.
I'm saying the capital should chase an Indian platform or an
That
Indian set
platform
of
is there.
companies.
That platform is
that
called.
will help.
That platform is called Carpool.ai. It's there. It's already
I'm aware,
funded, and so that is there. What we need to build is probably more. Uh, I don't know what's the right word. More comprehensive or larger AI algorithms, maybe which can break the silos, maybe which can look at a chest X-ray and be able to look at the heart, be able to look at the lungs, the bones, everything together. And especially with the large language models, Gen AI, agentic AI now coming in, probably that'll happen. And I agree with you. If we can share data amongst ourselves, it should not be impossible to build something, because now with the level at which AI is, actually all these existing AI models were built with deep learning. But today you're able to feed in clinical data, you are able to feed in the images, you're able to feed in pathology, everything, genomics, all can be fed in to make sense and to make a comprehensive algorithm. I think, Karthik, we just need 100 million.
Sir, to Dr. Atul Kochar, actually, sir, this digitization is a big word, and Ayushman Bharat Digital Health Mission. Because until we have the platform, we will not be able to succeed, and the proper data and the big data will be there. Are you putting something in your quality standards that the hospital has to have a complete risk packs and EMR kind of a thing? Because that is must actually. If we want to build up even the better AIs, because all the data can be combined and the data will be in your mobile, should have be in your mobile, that no films will be needed, nothing. So those kind of ecosystem, unless is made, it cannot be reached to the last mile of the patient, because it should be in the hand of the patient.
Thank you, sir. I think NABS today is probably the only accreditation body with end-to-end digital strategy. We have accreditation standards for all sorts of hospitals. We have big hospitals, small hospitals, Ayush hospitals, clinics, small clinics, PHC, CHC. That's one thing. We also have digital health standards, which we launched 2 years back, and thankfully 650 hospitals only have reached there, gold, silver, platinum, silver, gold, platinum. And we also have now standards for past 1 year for HIS and EMR products. And 70 of the cutting edge, like top 70 companies of India who are operating in India, including eClinical Works, everyone, I mean, they are, so they've already applied for that. So probably within 6 months, if not, or 1 year at the latest, you will have a majority of the software which goes into a hospital has to be NABH compliant. And we are not speaking about ABDM, so it's a free world, free enterprise, free choices there. But they all are going to tell people about KPIs, everything which is required for accreditation is going to be there. But largely speaking, the medical industry in India flies under the radar. There's only 10% of the listed hospitals. The 90% of the people are operating on a cash, manual, paper basis. So for future to sink in, future to come, digitalization is very essential. So some regulation probably will have to be brought out. Some sort of, I mean, we leave aside the ABA number, HPR, EPR, probably they're not viable for majority of the private people. But still, some sort of moral, ethical, I think, because they don't comply to any rules. I mean, and they give the other 10% a bad name also. The insurance system, the NCX, they all are part of our standards. The insurance exchanges, everything is there in the system, but now the adoption has to come from the industry.
That will be a UPI movement for UHI, like
Absolutely.
Unified Healthcare
Absolutely. You know,
Interface.
the platform is already there as far as the Aadhaar did that, the ABDM did that. It follows the FHIR model, FHIR model, which is a free resource. And it's much superior to the HL7 linkages also. Fortunately, all those things are there in the system. Adoption is taking place. It's at a snail pace, but probably the next few years are going to be very, very critical and very important with the push from the government.
Thank you, sir.
So thank you, everyone. As we wrap up this highly insightful discussion, at times it was literally like looking into a time portal into what this healthcare future will look like. I want to thank all our esteemed panelists, chairs, as well as the audience members who shared their insights and valuable perspectives towards how the healthcare delivery will evolve amidst this rapid technological, operational, and strategic change. So hospitals of the future will not only be a building, but it will be an interconnected hub of care delivery. Clinically, there will be a shift towards predictive, preventive, and personalized care supported by genomics, AI, and data-driven decisions. Operationally, with resource optimization, automation, and new business models, hospital will deliver care with both efficiency and empathy. Digitally, interoperable systems, remote monitoring, home healthcare, telemedicine, and even virtual wards, who knows, will complement traditional hospital beds. Financially, investment will focus on innovation and scalability to serve India's diverse and flourishing population. Experientially, patients and, if I may say, healthcare consumers will demand convenience, transparency, and trust. And regulation will also have to adapt at a faster pace than it is adapting right now to address digital safeguards, green infrastructure, procurement best practices, and outcome. So ensuring all of this comes together to create a steadfast commitment to quality, scalability, sustainability, and wins over public trust. Thank you so much for listening to this futuristic interaction with our panelists and our audience. Thank you so much, everyone.
Well, on that very optimistic note, thank you so much, moderator of the session. Thank you so much, Honorable Chair. Thank you so much, esteemed speakers of the session, for that very significant, very gripping session. I must say, a huge amount of takeaways. Ladies and gentlemen, thank you so much for participating. With that, we have come to the concluding moment of not just the session, but also the conference. And may I request our Mr. Varun Khanna, who is the co-chair, Ficci Health Service Committee and Group MD, Quality Care India Limited, to kindly give the concluding remark. We quickly take this opportunity to get a group photograph. Requesting Mr. Varun Khanna to kindly give the concluding remarks. Well, before we ask Mr. Varun Khanna to kindly give the concluding remarks, we have a very special mention to make. We're extremely thankful to Mr. Dan Vadet for joining us, not just for this evening, but also for the conference. We really value your inputs. They have been incredible. Thank you so much for being with us here in these 2 days conference. That has bring in a lot of energy. And on behalf of Ficci, we like to present a memento to Mr. Dan Vadet. Thank you so much for joining us. That means huge to us. And now requesting Mr. Varun Khanna to kindly give the concluding remarks.
All right, good afternoon yet again. Honestly, on the verge of good evening. There are 2 ways we can end this fast. I'll ask you 2 questions. Answer to both of them should be yes. Did you enjoy the conference? Come on, put your hands together. The second one is very important. If you say no, it'll be a long drawn conference even from now. Did you learn from it? Come on. Ladies and gentlemen, what else is there to close? It was a fantastic 2 days. We loved it. I'm sure you all loved it too. I've heard voices from each one of you, and I think those voices are positive. This last session seems to be more engaging than ever. I thought the last session was supposed to be quick, round up, get over, but I've never seen an audience ask so many questions, man. And that to the front row. It was like as if this is the only part of the conference that was missing earlier. You know, the spectrum of what I saw between yesterday and today was phenomenal. And that tells us the length and breadth of what we do as a sector. When I started this journey thinking about care at 25, it was all about the wisdom that we need to capture from the people who've been the legends and the creators of the industry. I still don't know, and I think I believe this session a little bit. I don't think we really know what the next 25 years are going to be. But if we continue deliberations like this, I can assure you at every step, we will continue to evolve and make our country, ourselves, significantly better. There are 3 things that I want to leave you with. One, I'm sure supply and demand we'll all figure out. Supply and demand of healthcare. Whether it is supply coming from beds, supply coming from technology, supply coming from AI, demand coming from whether it is need, whether it is funded need, which is Ayushman Bharat, CGHS, us, OP. My sense is that no one has a pulse of the demand and supply piece of it. There's one thing that we've not touched upon, and maybe we'll try and do it next time, is you all, we all as a consumer. We spoke about everybody else, but we did not speak about ourselves as a consumer. How evolved are we? How much are we asking for? How much are we claiming? That will define what our next generation is going to be. I'll leave you with a little example because I love my daughter more than anybody else. I was in New York and she got injured and we went to a doctor. There was a small little cut, a couple of stitches. But before she got the stitches, she wanted to know the entire resume of the doctor. And I was wondering to myself, this is the new generation which really wants to know how much have you done? Have you done these cases? Will it leave a scar? Will it not leave a scar? What's the protection after that? How do I manage that? I said, हमारे यहाँ patient आता है कहता है डॉक्टर साहब प्लीज सी दो और उसके बाद चला जाता है और उसके बाद realize करता है कि scar lifelong है. I think that consumer part of it is what will define what the supply looks like. So be that consumer, ask for it. Somebody spoke about the bull mark and ag mark and all of that yesterday. I don't know whether the mark will come in tomorrow morning or not, but we can switch in a day. We can switch to a more evolved consumer in a day. So be that consumer, spread the message, life will be good. Thank you so much.
With that incredible note, we now conclude this session. Ladies and gentlemen, may I request you all to not forget to put your mobile phones back to its ringing mode. Thank you. This is Sushmita signing off. Please take care. Namaskar.